Awesome. I was going to keep this open, for everyone. If you wanted to, I know Rebecca and Nancy, while you have John on here for just a few more minutes, if you wanted to say a few things, I'm going to have to switch to my cell phone and be a participant on the go. And Douglas is also going to jump in a little bit more here to continue the conversation. But I now have to get in my car and drive an hour and a half up to with the patient that I brought to the appointment yesterday, went through the emergency room and ended up getting admitted. And she literally has no one in her family or anyone to communicate with, which is really hard. And I want to go see her and make sure she's doing okay and make sure she's getting everything she needs. And since she was admitted last minute, the poor thing, she has no phone cord, no necessities from home or anything like that. So I'm going to stop by this CVS, pick up a few
doing
things.
God's work, Kim. You're doing God's work. Keep it up. Happy Easter. Drive safe.
Yep. And I'll get on the other line. I think Marie wanted to jump in before I go.
Yeah, I got to switch over in about 2 minutes, but Nancy and Rebecca, I'm happy to kind of review things at some, if you'd like. And
that would be awesome.
Kim does a good job of kind of getting me the nuts and bolts, and pictures are worth 1,000 words, and that's usually where we're at. But if what I've always said is, if you truly trust the physician that you're working with, and he or she, you think that they have your best interest in mind and they're competent, then you have to, you kind of, it's like jumping off a cliff with a parachute. Like that parachute's going to open. You have to trust it's going to open. It may open up pretty close to the water, but it's going to open up. And that's what I would say. Because we're just like anything, there are good doctors and not so good doctors. There's good mechanics, not so good mechanics. But if you find somebody that you trust and you latch onto them and they feel like, we're all pulling the rope in the same direction, and I always defer to their mission, what their consultative, their expert opinion is. But I'm happy to review it.
Can I offer a little caveat there? The
Always,
number one
always.
issue that I have, and I never thought about this before, but I hear the same thing actually from all the doctors. Hey, if you like and trust them, great. You know what? Go with them. But what we're finding is the number one reason why patients end up, in a sense, not going with us or not following, a second opinion that we suggest. They'll come to us and say, we've got a problem. We're sitting here in pain. That, I have rest pain at night, or I have ulcers or whatever. And I'll say, okay, well, do you want to get a second opinion? No. I like and trust my doctor. I just needed to vent. And I'm like, but you like and trust your doctor, but they are not offering you another. No. I don't want to go against my doctor, and I don't want my doctor to be mad at me. And they're friends with my other doctor. And I mean, I trust them, and they're highly regarded, and they have great pedigree. And, they graduated from Harvard, and they're the head of the department at this big university. And I'm like, so then why are you calling me? I'm telling you that there is another option for you. I'm telling you that 90% of vascular specialists are not trained in advanced tools and techniques. And what does it hurt to get a second opinion, get a third opinion, maybe get a fourth opinion, and then you can make an informed decision that's right for you, because it is possible that you can like and trust a doctor and they're doing what they truly feel in their heart of hearts is in your best interest, but they're only using what they know. What if it's possible that they don't know something? Is that possible? And what I've learned over my journey over the last, since 2016, and traveling the world to nearly a dozen countries, more than 30 states, is that different doctors have different tools, different techniques, just 100%. Different modalities, right? Some are involved in new research. There are some new drug-coated balloons that are used below the knee, and they're used across Europe, but they're not available here across the US, only in certain research capacities. And so what happened with, I think Thomas was on here, is that I just happened to know that a specific doctor who is a cardiothoracic surgeon was involved in research studies for new modalities for wound care. And that was a big thing for Thomas. And it was a little against the grain. It wasn't what people would think. Well, why would you send him to a cardiothoracic surgeon over here that's almost 2 hours away versus sending him over here to this other doctor who's a great vascular specialist? And it worked out really well. I just happened to know, because of my connections and my relationships with different facilities and doctors, not financial. I will tell you that we can't take money from doctors. You know that. But there was a physician that was nearby that I knew would be best for him. And he was able to get these crazy wounds healed, whereas another doctor wanted to just cut off his leg. So, there's a lot that happens. Medicine is still a practice, and you can like and trust your doctor, but it is even more important. Continue to like and trust them, but get a second opinion, third opinion. You're not going against that doctor. You're not disrespecting that doctor. John, you wouldn't be offended if I said, you know what, John, I believe in you. I do think you're the best. Just like in this case with Dr. Kirk Minkus, he is literally one of the best in Arizona. He's amazing. Heart's right, advanced skills, antegrade, retrograde, pedal, everything. He tries everything. But what if there's a different doctor in that area that might be a part of a research study with a new tool? What if there's a doctor that there's that new technique, the DVA, deep vein arterialization? What if she's a candidate? And what if maybe Dr. Minkus, I don't know, is not trained in that? And because he's not, and he doesn't know it's available, but I do, that I can then get that patient to a different doctor that might have that skill. And it has nothing to do with whether I like or, trust a doctor.
No, I mean, I agree. I mean, there's some of it is physician ego, and I'm editorializing a little bit, but I mean, if it's not me, then it's nobody. There's an attitude there. To your point, there is just potentially lack of knowledge. I mean, what I've encouraged patients to do, and I learned this a few years ago when I was listening to somebody talk about a complex procedure, and he had said, why am I up here on the podium? Why am I giving this talk? Well, I've done, and he listed the numbers, whatever. I've done 200 or 300 of these. I've done this, and this. This is why I'm, giving this talk. So in parallel, I'll tell patients, ask your proceduralist or surgeon, like, how many bypasses have they done? How many, you don't have to be specific about what tools they use, but, ask them, hey, how it's kind of like you take your car to, if you've got a Cadillac, you're not going to take it to somebody who treats or who takes care of Mazdas, but you also want to know, like, hey, does this guy do a lot of Cadillac work or doesn't he? I mean, like, that's a fair statement, a question to ask. And that's what your doc's going to be probably taken off guard a little bit, and they're going to have to pull their numbers, but we all have to record our numbers, so to speak. And I think that's a great opportunity.
That's a great
ask them, how many of these have you done? What, and the truly special physicians are those that'll say, you know what, this is not my area of expertise. I'm going to send you to somebody. Because for me, I'll get referrals for patients who have, quote, vascular medicine issues. Not my area of expertise. Happy to see them, but I push them on to somebody else because I'm not doing them any service by, kind of not knowing what I'm treating.
And you know what? That's a good point. I want to get you and your partner who's a vascular medicine specialist on to actually do that conversation at some point, because we have not had a general vascular medicine doctor. And I know, like the Cleveland Clinic, for example, they have a program for vascular medicine because it is a growing practice. And
100%. Because actually, I've got two partners, both of whom were trained at the Cleveland Clinic for vascular medicine.
Yep.
But again, it's you have the ability, and then I'm going to run after this and get on with my phone, but you have the ability, you personally came in the ability to connect people through a network. And I think that is a fantastic service to provide.
Thank you. I try my best. Sometimes I bang my head against the wall, but I wish I knew every doctor everywhere. I think every doctor has
But think
value.
about it this way. So because I was hanging TVs for my new clinic with my brother, who's much more handy than I am, and we're trying to find a stud to hang the TV in, and there's like 16 inches that should separate standard studs. So you can bang your head, Kim, and you'll hit, you'll find a stud at some point, right? And so you can put your head through the drywall,
I don't
but at one
quit.
point
I don't.
you'll get it. So anyway, thanks everybody. I appreciate the time. Kim, thanks for sharing your story with us.
Thank you. We want to hang our chat posters in your new clinic.
Yeah, for sure. 100%.
That would be amazing.
The folks we're treating are a little bit different, but nonetheless, it's all about raising awareness and trying to get people to be the best version of them. That's all it's about.
And you know what? Just before you go and I go onto our phones to travel, Marie wanted to say something really quick. I said, Kim, I want to tell you something before you go. Where's Marie?
Hey, Kim.
Hi,
You remember
Marie.
the picture I sent you 2 weeks ago? My foot was in CLI.
Yeah.
And I told you I refused to go to the doctor. I'm not letting them do it. Let me do it my way. Well, after I don't know how many hours, I don't know how many steps in a pool, I am going to show you my feet.
Wait a minute. I want to see. I can't see because Peggy jumped in there. Talk, Marie, so we can see your feet.
You see it?
Oh my God, Marie. Oh, I have to send John. Can I send John the before?
Yeah.
John, oh my God.
Don't tell me walking in water don't work.
Yeah, they told her that walking in water doesn't work and told her they wouldn't sign her up for.
Yeah, I don't recommend that. If someone truly has a vascular wound, because
I don't have any open wounds. I've never had
worry
an
about
open wound.
all the bacteria because the water's warm. You worry about the bacteria getting in there. That's why we tell patients after intervention to stay out of hot tubs and things of that nature.
No, I've never had an open wound, knock on wood. But yeah, I was in CLI 2 weeks ago. When I sent her a picture, she was scared to death, called my vascular. My vascular called me on his cell from home. And I told him what I was trying to do. He said, all right, let's make you an appointment for next month. I'll give you a shot to do what you're doing. And there's my results.
For you. Hey, you know your body. You know your body better than anybody.
She walked. I'm so proud of you. And this was one of the other things that we did was we were able to pay for at one point getting her a pool pass, a subscription for a couple months, for the pool so that she could walk. She couldn't walk on land, but she was willing to walk in water. Movement is movement. Movement is better.
If you're walking on water, then that would be interesting too.
If I could do that, I'd cure you all. But I just wanted to show you, Kim, before you get on the road.
Marie, that makes me so happy.
See, there you go. Motivation. Yep. Keep the momentum going.
Love you, Marie. That's amazing. Thank you so much for sharing. I appreciate you. And I want to let Douglas jump in.
Easter.
Douglas, happy Easter, everyone. And I want to let Douglas jump in and continue the conversation. We have some great people on the call. Douglas, you know that Rebecca is a nurse. Just saying. I don't know where Douglas went. I think he might have. There he is. Okay, Douglas, I have to jump in and switch. So if you want to take over, and I'm going to actually make you the admin on here so that you can take over. Or should I I don't know if Josh is going to stay on for a while and if we should continue.
Oh, I'm listening. Yep.
Do you want me to add you in here? Should I continue the live on YouTube?
Oh, you never started the broadcast, Kim.
I never started it. Oh.
Nope, you just started the recording. That's okay. I can put the radio show up on YouTube afterwards.
Wow. Well, that is pretty awesome. So I hit go live, but I guess it didn't. So
I don't think it did.
It didn't.
Well, I wish everyone would have told me. I didn't know. I hit live and then I guess it just did not go live. And I didn't bother to check. That would have been a great one to go live with. Whoops.
It's still gonna make it up there. I just need that recording.
Okay. I can, send that to you. And if you could do me a favor though, that one part, because I'm gonna smack Douglas. Douglas knows it. If I go to you during the radio show and I ask you a question, answer the question, don't tell me to go somewhere else. It's like we're wasting time. But he has such a good heart. He wants to keep the focus on everyone else, which is so sweet and so kind. But if you can cut that part out and just
that all happens after the radio. Oh, no, you're right. That is there. Yeah, I can skip through there for sure.
Yeah, if you can cut that out, just go to my throw to him and then go to his question and then we'll go to his answer and then go, because I was like, just so it flows. That's all.
No worries.
But Douglas, you want to take over? And I before I run out, and I'll get on the other call. Let me see. I need to make host. And where's Douglas? Douglas is iPhone. I'm gonna have to start. Oh shoot. Can I? Oh no, I gave the host to Josh. Add shit. Oh well. I gave the host to you, so now can you add Douglas as co-host? I messed up. I thought I could add 2 hosts, but I guess I couldn't.
Done.
Okay. So Douglas, you just need to accept that. But I want to make sure, Rebecca and Nancy, before I run, you have my phone number, so we can chat as well.
Okay.
I want to go over some things in detail with you both and understand things. And I really want you to if you can get me that CTA, the last one that Dr. Minkus did, and see if we can get that on, CD and then get it so that we can put it on the computer and share it so I can share it with a couple other doctors just to see what's possible. It sounds as though there is some blood flow down there. There sounds like there's some collaterals that we can still build, which give me hope, because we have had people on deck for amputation that have literally walked their way and continued. It's not easy, but they just one day they woke up and they suddenly just felt a difference within, 6 to 8 weeks. Might take that 8 weeks to start to see the difference, but they pushed through and they were able to grow enough collateral vessels to actually give themselves enough pain relief to live their life without a procedure. So, and it might be enough to get us to a point where innovation is just happening so quickly. I expect new technologies in the next 6 months, drug-coated balloons from below the knees, new deep vein arterialization procedures, things like that can help. And so we just need to, day by day, just keep pushing.
That would be,
but I also want to still get her a second opinion from someone else who, like if you can drive to El Centro, California, in the next year, there might be a new technology that I have seen in the past that I think could be rekindled that has worked miracles through 100% occlusions and does it safely for people with fragile vessels. So there is hope out there. Whereas a doctor can only say there's no hope. Well, we have nothing but hope. Like, what else can you do? We're not giving you false hope. What we're doing is we're saying, hey, you know what? You can walk today. We're going to wake up tomorrow. We're going to walk again. And you know what? There are some things in the pipeline. And let's just keep doing what we're doing until the point where, you know what? There is some new stuff available. But I think that different tools, different techniques, maybe a different set of eyes, maybe just one more try in a very safe, effective manner with you saying less is more, doc. We're not trying to go 0 to hero. Let's poke in the foot, come up, and just carefully see if we can eke through just one vessel. Just give me one more tiny pathway. Don't clear the whole artery. Don't need to do that. Just see if we can get a little bit more flow there, just so I can walk. I know it's not durable. I know it's going to close up, but it's going to get me moving a little bit more with less pain meds that are going to damage my liver and kidneys. And I'm going to grow more collaterals, so you won't need to open that up again. But can you just throw me a bone?
Mm-hmm.
And maybe there's a doctor that can throw you a bone.
Okay.
And maybe there's a new technology that comes out in the next few months or year that can throw you a bone and get you just that much more. So we're not giving up. We're going to continue to work together. And there are other doctors in Arizona. There are amazing doctors in Arizona. And maybe just one more poke in the foot and coming up with a different set of eyes might make all the difference.
Okay.
But we won't know unless we have that CD in hand and we can see the vessels.
I'll get a hold of that.
So I want to leave it. Sorry, Douglas, I'll leave it to you. And if you want to talk, any more to different people, I'm going to jump on the other line, but I'm just going to be on the go when I do it, if that's okay.
Mm-hmm.
But I'll let you guys take it where you want to go with it. And maybe, Douglas, you want to talk to Rebecca for a few minutes about, just her experience as a nurse, and maybe people have some questions for her.
I'll admit off the bat, I worked in a cardiac unit in a hospital, a major cardiac unit, but coming into this, I pretty much knew nothing about peripheral, because everybody that we had in the hospital, it was just coronary, basically. So, I don't remember us having patients admitted with peripheral. It was just, so I didn't even know much about peripheral.
Kim, can I say something real quickly too? I just wanted to thank Douglas for the meeting that we just did with him, where he wants to have a weekly session and talk to all of us, have us come up with things to talk about, because it really, really helps me, and I'm sure others, when we talk among ourselves like we're talking here with you and John and everyone. So thank you, Douglas.
Douglas, are you going to jump in? Because I don't want to just leave and with it being silent, because we still have quite a few people, and I want to see if you want to jump in and start the conversation. And I had mentioned that, thank you so much, Nancy. And yes, we're gonna add another one for the week that we're gonna do, and we're gonna keep this going. But Douglas, do you want to also continue the conversation here? And I think that's interesting with Rebecca and her experience, and maybe she has some great stories even to share. But it's also interesting that she was in the cardiac lab and didn't know about peripheral artery disease prior to this.
Yeah. I also have to add, what is nice to meet you, Josh, and just tell us some about yourself too, so we can.
Can we, Douglas, are you okay? First, are you okay?
Yeah, I was just curious about Josh and his experience and that.
Okay. We could get to it. I just was starting the conversation with Rebecca.
I know. We got it.
Well, I don't want to, disrespect Rebecca. Rebecca's here.
Oh, no, I'm fine.
I can be brief. I'm stepping in to help Kim with some technical support, things like YouTube production, so on and so forth.
That's cool. That you got that experience to help us, don't you?
I have a little bit of experience with it. I'm a Microsoft Cloud service provider and a YouTube producer for some other charities and nonprofits.
Cool. We got So it like with Nancy, I did put that out there, and we got quite a few responses. So we're going to bring that up this week and set a list and get that taken care of.
Awesome.
You know, now we're going to worry about the time because everybody's in time zone. So that's going to be a little query trying to get the time zones correct for everybody to join. It'd be nice if we were all like in one time zone, but unfortunately, we're not all in the same time zones.
Hey, Doug.
Hey, Alan.
Hey, buddy. Hey, what do you think about a weekly support group? Video support.
That's a
People
part
can
of what
talk
we
about different things, and
yeah, that's what Nancy was. We were going to bring up, Alan, is that once a week we were going to have like an hour where we just get together and talk about all kinds of things that we want to talk about amongst ourselves that we share, because it's like learning about Rebecca's experience, and we talk about stress, relationships, family, what about money and how we deal with all of that, and doctors, and what about new procedures that we know about? What about like Marie with the walking? You know, some people you have to be careful if you have this or that and walking in a pool, because I remember my doctor telling me don't get in the pool after I had my surgery too because of the infection sense. So, but
there's 1,000 different things to talk about.
Yep, there is in there
Easily.
You know, so yeah, and it deals with all of us, doesn't it?
Sure does.
It's like having Rebecca here is like the other side. I get it's like the other side of the coin, so that we get her experience as a nurse and what she's experienced and brings to the table with us also, and
Well, that can be invaluable.
And dealing with her mom and how does she and everything that Rebecca goes through that we don't, because think about your wife, my brother Grady, and all the stuff our families go through dealing with us.
That's right.
How do you explain to your family the pain if they don't know what the pain feels like?
It's hard to describe.
Say that, Rebecca.
What
were you saying? In your unit, what?
Yeah, I was just and I was typing.
It looks like you might have to stay here, Dad. Okay.
Yeah, I was just and I was responding to Kim too in chat that it could be that there were peripheral patients getting procedures done, but just on my unit, I was working with the ones that were admitted. So it was mostly like cabbage procedures, heart cath, that kind of a thing.
It's funny you say that. I was in the hospital on a heart thing. I told my doctor, my cardiologist, this was like 15, 16 years ago. Hey, doc, let's check out my legs are killing me. And that's where I discovered, walking pain. I didn't know what it was. I had an idea, but no idea really.
Was it just, I guess if it's a cath lab, that's it. Like you say, that's it. Basically what you get, isn't it?
Well, yeah, I was working the inpatient unit, so I wasn't involved in the cath lab per se, aside from sending our cardiac patients to and from it.
And $10 says about probably half of those people may have had a little bit of our peripheral artery disease that nobody knew about.
It's very possible. And unfortunately, my experience in the hospital is that they focus just directly on the one area that the person is there for.
Yep.
We talk about that a lot in the group, don't we? Is how do we
Yeah, Douglas, we do. How many times, Douglas, have you been in the hospital that they literally get laser focused on one thing and then they miss the other? And it's frustrating. And I had actually a cardiopulmonary specialist who, after a presentation I gave in Montana recently, said to me, and she's a nurse, and she said, Kim, part of the training for a nurse is for us to go in and literally do a head to toe. No matter, every single time we go in, we're head to toe. That's how we're trained. That's what we need to do. And we go in and we write the report. And how many times, she said, that the doctors would ignore her report when she would write in that they have low foot pulses. And this is, and I see you nodding, Rebecca. I mean, how many times did you go in there and you didn't think anything of it because you're like, you know what? I'm putting it in the report that I'm not getting a pulse in the foot. And the doctor just.
Yeah, I think so many times I think there's just a big, God, I just had the word, there's definitely a big area where things are missed. And, I haven't been nursing since, I haven't been nursing, especially cardiac, for a few years. I know these days it's even worse with the patient to nurse ratio. But back when I was on the cardiac, and it was a busy cardiac unit, there were times that we should have only had 3 to 4 patients, and there were times that we had 5 to 6. And I'll just say, I came in one time on a patient who had been there. He had been there, I think this was day 8 that he was there. And this was my first time having him. So he'd been there for 7 days, and we charted every 12 hours. And when I went into his chart, we had the ability to copy the previous nurse's chart over and then just go in and fix things. And unfortunately, people are strapped for time and everything, and everybody can start to get kind of not as conscientious about it. And I was there on day 8, and everybody all along the previous 7 days had charted equal pedal pulses. And I'm like, well, that's fabulous. That's really fascinating, because the guy is a below knee amputee. So there can be so many disconnects from so many different areas. On the cardiac unit, we were only doing focused assessments, but even if it was a focused assessment, it should have still involved pedal pulses.
And Alan had that part right a minute ago when he said, I wonder how many of them patients that are in cardiac unit have peripheral artery disease, because we know the two are correlated in a lot of people. And most of us didn't know we had it, or we assumed it was something else.
And in my experience, my unit was a combination. It was cardiac neuro unit. In my experience with it, we got patients in and we just ruled out anything life-threatening. We'd get them in, we would rule out heart attack or stroke. And then once we were sure there was nothing that was going to kill them within the next day, they were released and told to follow up outpatient.
And I wonder if we could go, I wonder how many of them actually did that.
That's the question, and then the hospitals released them and done with it. But yeah, most of the time, if they came in and if we couldn't show heart attack or stroke, they'd be released, and the doctors just tell them you need to follow up outpatient. And
So
and then we don't know if they actually.
If I left there and I went in there with those symptoms, and then I was told, "Oh, you're okay," I'm probably not going to follow up, because that doctor says, "Oh, it wasn't a stroke or a heart attack. You're fine."
Yeah. Sadly, unfortunately.
That's what really pissed me off about Douglas's situation, is because he's sitting there with real chest pain, real stuff going on. Turns out later on, we find out that he has, a narrowing in his coronary arteries, but this that gave him some relief. And here are these doctors. He's in the hospital. He has an episode where he can't even drive. We call 911. He goes in there. He's in there for 5 days. They do nothing. They literally do nothing. And then they're like, well, you might need this medication. We don't have it here. We can't prescribe it here. So we're going to release you. And you can go pick up this medication, which we think may work. We're not sure, possibly. And, just go home. And there was no referral to a different specialty. So here you have the cardiothoracic surgeons that are looking at the structural side. Well, there's nothing we can do structural, but they're not bothering to assess the coronary arteries, and those needed assessed. And it's very frustrating. You're right? They get very myopic.
One of them walked in.
Other topic, Douglas, that I think
one of them walked in, and I told him I had atypical hydrocardiomyopathy, and he goes, I had to look it up. I didn't even know what it was. And it was like, I looked at him like, well, see you later. He's like, no, thank you. So, and how many of us in the room have we dealt with that? It goes back to that topic. The doctor that did my bypass here in Beaumont, we call this the Tri-County. Everybody knows this guy. Everybody knows him. Everybody says he is the absolute best in the whole area. But after I had the bypass and I saw other doctors, they said, well, why didn't he do this? Why didn't he do this? And it brought up that question to me. Did he know any other procedure other than just, if he couldn't get through, I'm just going to do a bypass and move on to the next person? And how many times do we hear, well, it's cheaper to do a bypass than it is to spend the 3 hours or 4 or 5 hours trying to get through something. It just, I'm going to spend 2 hours and make this kind of money on this procedure instead of spending 5 hours trying to do this and not make that much money. We all know amputations, they make more money on amputations than they do the procedures. So is that where the doctors have to take on some of that responsibility of learning new procedures and new ways of doing things, or have that ego and says, I don't know how to do that. You need to see this doctor, and let that ego part go, So yeah. And so it goes to that whole process, doesn't it? So when I left that doctor, I mean, everybody knew that doctor. Everybody told me he was the best, period, in the whole area. Now, his bedside manner is atrocious. It really is. But everybody was saying just overlook that and think about his procedures because they're the best. But
that is true. That is true with a lot of quote great surgeons. Their social skills suck because they also like my vascular surgeon that's retiring. I swear to God, he suffers from ADD, but boy is he focused. And his bedside's he's okay, but he's always in a hurry.
I was told by a fellow patient in here that he was in a meeting one time with this doctor, and the doctor said, I'm God. I'm it. I mean, and I would have got up and walked right then. It was like, oh, I don't know about that,
Yeah, I'm on the other end of the spectrum. I'll fire a doctor on a heartbeat. I did it in the hospital on the floor. The floor docs that were taking care of, because they have hospitalists now, I didn't like him and what he was doing. And I said, you're done. Get out. Give me somebody else. And he was going to make a mistake. And I knew it. And that's okay.
And how do is it finding that balance? How do we trust the doctors when they do have the white coat? They're supposed to be the ones who know how to do this and how to do that. And so if we were all to go back, the very first time we went to a doctor, when the very first time I saw my primary physician and I said, my legs are hurting. And he's supposed to be the doctor, he's supposed to know this stuff. They went to all these years of school. They have that little piece of paper hanging on the wall. So if I don't know nothing about PAD, never heard it before, how do I walk out of that office thinking, uh-oh, until I meet people like in this group where I learn some stuff and I learn some of those questions and I have to learn to ask those questions about that doctor. Well, so I think it was the third time he took my shoes off. So let me check your feet. And so, but if I had not gone back, complained about my legs again, where would I be? Where would some of us be? Thomas goes through that with his doctors. And is it different in Louisiana? Is it different in California? Is it different in Texas? What about doctors in Virginia? Or do they or do they all have that mentality? And as patients, if we had, like, I think Nancy said this one time too, where if we had not met this group and Kim gave us some of those questions to ask, what questions would I have asked if I didn't know what to ask?
You'd be like everybody else that just goes in, shakes your head and agrees, and you move on.
Mm-hmm.
And then they either screw up or can't do it.
Or I end up losing my leg because I don't know the right questions to ask, or I get worse and worse in that.
Yep.
I walked out of a doctor's office on the 25th floor one time. Kim was there and Kay was on the phone. And I remember standing at the window and well, you know what? I'm just going to jump. Because he just basically said, sorry, dude, you're going to lose your leg. See you later. And it was like, well, shit. I mean, shoot, I might as well just jump. It's like, really? And how many of us get to that point of, I don't know, do we lose hope? Is it discouragement? Or is it hard to find hope when we're hurting? Is it hard to find courage to walk to the end of the driveway when my pain level on my leg is a 10? And I'm not gonna say a bunch of stuff, but I tried to walk this morning and I couldn't even walk to the end of my little short block here because my left leg was hurting bad today. So I'm just gonna hang around the house. So how do you get to where we were in the beginning to where we are now? It's like
the thing is, Doug, you got to remember that there's always a new beginning with PAD. It rolls like a Rolodex, and you move on to the next problem, next card. Just like I just had everything done, and Kim just saved my right leg again, and I'm blocked in the profunda, and the popliteal's blocked, and it's starting all over. It never ends.
So, I mean, Nancy, do you have those small open sores though, right?
I'm sorry, what?
You do have some small open sores.
Yeah.
So it's like, if you didn't, would we be able to say, why don't you go jump in the swimming pool like Marie did and walk back and forth,
Well, I did walk in the swimming pool for ages with some of these. And you got to figure that there is chlorine in the pool. I'm in an adult community, so there aren't kids in the pool. And you just hope that they have, chlorine and all. And I'm thinking maybe the chlorine will help heal the open wounds though. but I put iodine on every day, and Rebecca will tell you this morning I put it on, and man, I was in pain for hours. So, and by the way, Rebecca, it's finally lightened up a little, but you know, this.
Is she being hard on you?
Uh-huh.
Is she being hard on you?
Yeah. Oh, she was, bless her heart, she had to listen to me gripe all morning. She stayed on the phone with me, and she had to listen to me saying, "Oh, oh, ow, ooh." So, but the doctor put me on.
Can I ask you a question about?
Yeah, go ahead.
Oh, well, I was curious about you swimming in a shared pool with an open wound. Like maybe somebody else that's swimming there has an issue of their own, and you know that wound could be entering into their bloodstream for any infection. Like, is that wise for you, but also for others, for you to be swimming in a communal pool?
You know, I haven't been in now in months, but I didn't have a doctor who said I couldn't. So
well,
I
don't mean that for you, but like, say I'm in that pool too, like maybe I might get some of your infection. You know, it goes both ways. I think we have to protect ourselves, but I also think it's wise to protect others.
Right.
And that's why absolutely, you got to hope that they're taking care of that pool correctly, where it doesn't transfer back and forth from one to another and from them.
You're on a wing and a prayer there. And as somebody who's had a pool, the sun depletes chlorine very quickly, and any wounds, the more the chlorine has to work, the quicker it's depleted. So say you got in there with a wound and it is working to kill that, it depletes the chlorine. And also sun does. So like if they do it in the morning and you get in at 6 o'clock in the afternoon, there might not be any chlorine left in that pool, even if they're doing their job.
Right.
True. You've got to remember, even chlorine pools, I had a saltwater pool. Every water source, whether it's clean water, potable water, whatever, carries bacteria, period.
See, right.
And that's how I lost my toes. My toes were burning so bad, I would put them in I had a little vat of water, cold water, and it created gangrene under my toes, and I never knew it.
Yeah.
And we know kids take care of themselves in pools, but I'm afraid I'm also suspicious of adults not using pools for.
You're peeing in the pool?
I'm still sure the adults will still pee in the pool sometimes.
Well, if they put that chemical in there that turns blue, I'd be kind of embarrassed.
So yeah, and it is, and we have an Olympic pool here, and they talk about that, about the amount of chlorine they put in the pool, and how often they have to do that to protect the pool, and it's like it makes you wonder.
Oh yeah.
Mm-hmm.
So yeah, and somebody was discussing this morning about walking shoes and high arches, low arches, and if you have a spot on your toe, how tight that shoe is. What about your socks? He was wearing compression socks when his doctor told him not to. His feet were hurting and he couldn't understand why until he went back to the doctor, and the doctor said, "Why are you wearing these socks? I told you not to wear these socks because it cuts off." Dr. Alpert talked about that. Do what?
Your ears have to be open when you go to these specialists, and they tell you don't do something. You better either write it down or remember it.
Yep.
Yeah.
Is Alan? Is that? So I'm in this. I'm coming up on 5 years of dealing with all this now. So I do listen more now than I did when I first started. It was like with eating, with the smoking, and with walking, and all of that. So I'm more open now than I was in the beginning. Weren't we all that way?
Mhm.
Yeah.
Mm-hmm.
What way? Were
In
we
the
what?
very
Open
beginning,
how?
yeah, in the very beginning, I was more trusting of the doctor
Oh,
than
yeah.
I am now because of what I personally know now about some questions to ask, and it's like, and when Nancy was saying her story earlier, my first thought, I was thinking, what I know now, it would be like, all right, thank you, but I'm going to another doctor now. Because you just basically said, I'm done. And we know through Kim and some of the stories we hear that there are doctors out there that can do things now that other doctors can't, right?
Right. Doctors in general are deitized. They put that white coat on, and they're like God. They're like God, and we're
Have
supposed
you
to
ever
just.
heard of
We were
Dr.
taught to
Walker?
respect them. I
Dr.
have turned
Walker,
my entire thinking
yeah,
process around on, and
Right.
I'm done. If I don't like a doctor, if I don't trust a doctor, I'm out. And it's just like I have, and thank God I know all these questions now with both of my vascular surgeons here that I've had for 15 years are retiring, and I've got a new guy coming in on fellowship. But I also found an interventional cardiologist at our hospital that Kim has heard of, and I've got an appointment with him to see his skill set. And I want to see what the skill set is of the new guy coming out of fellowship. You hear new doctors, so, well, maybe he's already trained. We don't know.
here's one, Alan,
Until
we
you get
don't
there and
talk
find
about.
out.
Well, here's one we don't talk about a lot. And Rebecca's here. What about nurses?
Nurses make the world go round. If that's the one thing I have learned to do is, boy, when I'm in the hospital, I take care of my nurses because they're the ones that are going to get it done. So I make friends with all of them.
You know, unfortunately,
They're my tie to the outside world, to the doctors, to the specialists. Without them, nothing gets done.
How many of us have been touched by more nurses than we have by the doctors?
Right.
And unfortunately, though, it's like the more I hear in the groups like this, I wish we had a lot more power, you know, to help the patients even further. But it's just, you know, when the doctors just when they're gonna be like so focused on the one thing and let's get them out of here, you know, we just don't have a whole lot of power to counteract that.
There was a
Right.
nurse. There was a nurse at St. Luke's in Houston, one of the best hospitals in our area, and people were talking about her like the doctors needed to learn from her because she knew and she cared, and it was just her experience was so much more than the doctor, because how many of us, the nurse deals with us more than the doctors do.
Well, I hate the way these doctors, even if a nurse reports, doctor comes in, they're doing their rounds, and the doctor snaps on the nurse.
Mm-hmm.
And I have learned half the time it's something the doctor didn't follow up on. They jump the nurse up for it, and I call them out on it every time. This boy's got a mouth now, and I've learned to use it instead of just sit there. Okay, no, we don't do that.
Rebecca's heard this story before, but I was in clinicals because I got my nursing license because she dragged me through nursing school with her. But anyway, I was in a clinical at a hospital, and there was a lady that I was helping, just, you know, student nurse type thing, and she had this really bad cough. And I said, you know, do you know what causes it? Because she didn't have anything but this really bad cough. And she said, no, they're doing tests. Anyway, long story short, she got a call from her brother. And I said, here, I'll leave. And she said, no, stay. And then I could hear him coughing. She wasn't from the state that in the hospital she was in. She was visiting. And then she said, I said, who else has got this cough? Thinking, something going on. And she said, well, my pastor does. And I said, okay, where were the three of you when when you were all together? They were at a heated inside pool for a birthday party. And immediately I thought of Legionnaire's disease. And I mentioned it to the nurse of the room, and she said, oh, would you go tell my supervisor? I told the supervisor that story. She asked me not only to call the hospital in that state, but to call the health department and let them know it could possibly be Legionnaire's disease and to check up on it. So nurses just don't have time to even talk to the patients to find out, the doctor says, what happened? Well, you're kind of, oh, it's the doctor. And well, I kind of hurt my foot. Well, what, they don't say, what did you do? When did it happen? All of that. None of them have time anymore. It's just,
And also maybe Rebecca can answer this for us too. So you're in a hospital, let's say you're on ward number 5. There's 20 rooms, and all rooms have patients, and now you got 5 waiting downstairs in ICU, but you're a nurse. And how many of those patients did you have at 10 or 11? So it is hard probably for y'all having to spend so much time in the room trying to comfort me when I'm going crazy. Right. Or feel bad, because now you got 11 other people you have to continue to deal with who are sick and feel bad as I do.
I mean, there were times that I would come into that cardiac unit and I would start with 6 patients, and during my day, all 6 would be discharged and I would take on another 6 patients. So during that 12-hour shift, I actually had 12 patients. Wow. And the hard thing about being a nurse, it's not talking to the patient, but if you talk to the patient for 2 minutes, the charting is horrendous. It takes 2 minutes to talk to the patient, but 30 minutes to chart about that 2 minutes of talking.
I just wanted to say, I've got a scoop at my prosthetic's killing me. I got to get it off. And Nancy and Rebecca, thank you so much for being nurses.
Oh, well, thank you. Appreciate that. Thank you for all of your assistance and input on this.
And how hard is it, Rebecca, to deal with people like Alan who are patients sometimes? It can be hard.
I'm the best patient in the world. I've had nurses walk down from top floors in the hospital when I was leaving. You forgot to say goodbye. I really, unless a nurse seems just having a bad day, try and cheer them up. But they go through it. I'm sure they do.
They go.
But I try to make it a joy to come see me, because I will talk about them. What's your day like? So they have a little. They can release some of that stress just through a talk.
How many directions are you pulled daily, Rebecca, from the doctor, from the nursing staff, from your boss, from us as clients? So you have to deal with all of us at the same time too, don't you?
Well, yeah, and it's just more like I said, like even if we come up with something, it's we're kind of batting against a wall in order to get something initiated with the doctors and the administration there. For example, I worked at another hospital on the medical surgical unit, and we admitted a patient, a young guy there from the emergency room, and he was coughing terribly, and every time he coughed, he's spitting blood everywhere. And we kept asking and asking and asking, did you think about testing for something like maybe TB? And we got nowhere. And he'd been there for 4 days. I came back on day 5, and suddenly we had all the precautionary stuff in front of his door. Yeah, finally they tested him. He was positive for TB. We'd all been in and out of there for the past 4 days.
And they're not listening to you because they're the doctors and you're the nurse.
Mm-hmm.
And that's part of that insanity, isn't it?
And you'd think, I mean, it should be standard protocol. That person should have never made it out of the emergency room without being tested for TB.
So I guess you uh, uh, have had that experience where you walked or you drove home that day thinking, I wish the doctor would listen to me because it sounds like I may not be the doctor, but I know what a little have an idea what's going on more than the doctor who just comes in, says hello, looks at a chart, goes on about his business.
Right, right. And just, our frustration, especially with that TB patient, our frustration was like, well, great, for the past 4 days, we've all now been exposed.
And
TB.
if you see a doctor anymore, all you see are the NPs, nurse practitioners. So if it's more serious than they can handle, they send you to a doctor, but you have to come back in a week or two, and they just fill you with pills. Here, take this, this, and this, and see how this works.
Well, before I got to Baylor, before I had my myectomy, my heart doctor here, I never saw him, officially saw him. I saw his nurse practitioner the whole time.
Right.
So it was Dr. L, but I never actually saw him in person because I never got past her.
Yeah.
He spent more time on the computer than look. How many times have we been to the doctor and we've never been touched?
Mm-hmm. Yeah.
He never touched. Take your stethoscope, touch my front, my back. You know, do
That's
something.
never happened to me, Douglas.
What's that?
You asked how many times have we been to the doctor and not been touched? And I said never. I mean, I don't understand the question. Or not ever being touched by your doctor.
I have been to some of the best, technically some of the best doctors in Houston, and Kim knows this. The last one was the heart specialist at Baylor, which is a great hospital. But I saw him 3 times. He never once touched me. Never once.
He never felt your foot?
Nope. Didn't check my heart. Didn't take the stethoscope. The last time I was in his office, he came in. We talked about the new medicine that's out there for cardiomyopathy. And then his phone beeped and he left for 15 minutes, came back, and he said, I'm going to put you on this. We'll see you in 3 months. And that was it.
But I mean, is that the standard? The standard that you get?
I think that
never.
I think it goes back and forth. I mean, and I think it really depends on people's experience where they are, and I think that varies so much out there that because answering the hotline and doing what I do with Kim and listening to the stories, you hear both sides of that. So it's not. I don't think it is one set way. I think it does go both ways.
It's happened to me. It's happened to me myself. I've seen it happen to my mother where they stand across the room. They don't even come across and even touch her foot.
Oh my gosh. I just can't even imagine.
Yeah.
I hope there's not a second appointment.
No, no. But it's just, doctors become complacent, or I don't know if it's that maybe it's half complacency and half of the time they're so overloaded with patients because of the insurance companies. For doctors to contract with certain insurance companies, like I know Cigna is one of them. For a primary care doctor to contract with Cigna, they have to agree to take on 2,000 Cigna patients a month. And, when they're that strapped and bound and they only have 5 minutes to spend with each patient because the insurance company dictates it, so there are a lot of factors in it.
So if I walk in and I don't have open stores, or I walked into his office with just a cane or no wheelchair, well, then you look fine and I got 18 more people sitting in the lobby that I need to get to today because they don't make the bookings. The nurse up front or the secretary up front makes the bookings. And you have 15 minutes with this one. And I have to admit, I'm sure the doctors, and Becca, you could probably address this a lot too, is that they're being pulled from so many sides also. Even the good doctors that we know talk about, having, if you're in the hospital, you have that whole administration saying we have to make this amount of money to pay running this hospital and all of that. So does it really come down to that money aspect and how many patients you see when the doctor wants to spend 30 minutes with this client explaining things? Dr. Duwall said that one time. She goes, my paperwork sucks.
Yeah.
She said that. She said, my paperwork sucks. I get in trouble all the time with these people because I want to spend more time with my client than I do the paperwork and putting the right words in the right place.
My GP here in Surprise works for a major hospital system that's here in Surprise and all over Phoenix area. And he told me one day that he's got an office in one of their big office building facilities. He has to pay them $10,000 a month to rent that space. He finally was getting to the point where his salary and everything kept decreasing because the hospital costs were more. He finally he got a second job at night to help pay all his expenses. And then he finally moved over to his own office in another building here in Surprise that is not run by the hospital. So somebody's making money, but the doctors aren't always making money. So it's, it sounds good, but in truth, I think they're strapped at times. And then another doctor that Rebecca used to work with that I went to see, all of a sudden I get an envelope in the mail and I open it up and remember Xerox pages? It was off center and it was purple ink. And it said that they just wanted to let me know that they would be contacting Medicare or something for me. And they had put me down as a patient that needed following every single month. And I didn't. I wasn't on meds. I had gone to him for, a serious cold or something. So I called Medicare and told them about the letter and told them about the doctor. And I said, and they said, thank you for letting us know. This is the kind of fraud that they get, caught up on. And you figure he was something about it. Somebody told me, I guess the Medicare people did, that they were paying something like $2,000 a month for them to manage us monthly. And he never managed me. I never saw him every month. One time I went into his office. I know his machine was wrong, but the blood pressure came up at 156. And I usually am around 129, but I have white fright. And so he was using that as the excuse that he needed to monitor me monthly so that he could make this money every single month and he never called me, never saw me, anything. So it's out there. There's fraud all through the system.
Yep. And I guess as a patient, we are the ones stuck sometimes in the middle between trying to find those good places that will take that extra incentive for me instead of I'm just a dollar bill or a money. There's a place in San Antonio, Kim expressed this. You walk in one side, you got both legs, all your limbs attached. You walk out the other side, most of the time, you're missing something. So it's like an assembly line. And the doctors that I have now, they have spent just one doctor, Dr. Bonilla, has spent more time with me in a room than any of the others. Dr. Walker in Houma, Louisiana is the only one that literally, he literally, he drew pictures. He touched every part of my body. He touched places I didn't know he wanted to touch. You know, it's like, but he did, and he sat right next to me. He drew pictures, and he literally answered every single question, period. And he kept asking, do you have anything else? Do you have anything else? Do you have anything else? What about this concern? What about that? But 90% of the other ones, like I said, I mean, I saw that top vascular surgeon in Baylor, and Baylor's a great hospital. Don't get me wrong. And he might have been, you know, I'm sure doctors get stressed too.
Oh, yeah.
I'm sure they have to deal with a lot of stress and a lot of frustration, either from the hospital, from me as a patient, from the nurses, paperwork, all of that stuff. But I saw him 4 times, and he literally never touched me one single time. And I remember driving home thinking, you know, why didn't he just even use a stethoscope? I'd have been happy. Just use a stethoscope, you know, listen to my heart one time.
And Douglas, you are so right. That would have saved my mom's life. Like literally, if the doctor would have just touched the patient and did what we call CHAT, C-H-A-T. It's an acronym for carotids, heart, abdomen, check for a bruit in the abdomen. Is it 100%? No, but at least if there's something serious going on, you're going to hear it. And T for toes, check those foot pulses. Just touch the patient. And maybe this is something, actually, Douglas, you're really good at it. Maybe you guys all can together, is maybe use touch as an acronym, and let's figure out if we can do an acronym with touch, like touch the patient. And maybe there's something there that we can create a poster for. That would be kind of cool.
I had my board meeting at TAN, Triangle AIDS Network. I'm on the board here. We started a new incentive of going out in the community with outreach program, and my CEO was saying, we're going to check this is this. I said, hello. And she goes, uh-oh. And I said, yes, you know, I'm going to bring it up. I said, why don't we talk to our doctors about checking pulses? She said, I don't know what. I said, it's easy. It's 2 fingers and a blood pressure cup. We have that. I'll loan you my 2 fingers. I said, why, when these clients come into our medical bus, why don't we take their shoes off, have them take their socks off, and have our doctors check everybody's feet before they leave? Because it's very important. I said, everyone we're checking for heart disease, 90% of them probably have some type of circulatory stuff going on. I said, that needs to be a big part of what we check. She goes, all right, we'll add that to the list. It's like, yes. Because how many people could we catch if we did that? Even just to say, even if it is to say, you need to find you a vascular surgeon or somebody to have these pulses checked, because I can't feel a pulse on the top of your left foot. Or if your blood pressure on your right foot is 20 degrees different than 20 degrees, 20% different than your left foot, there might be an issue going on. We can at least refer them to somebody, but we're also doing our part. And if it's the older generation, we do a lot of older generation with these outreaches. So we need to be able to do that. And I think it's preemptive medication, isn't it? Why did it take 2 years for me to see in all these doctors before I was officially diagnosed with PAD? Why? And how many people do we know in the group? It takes forever.
Yeah.
You know?
Mine started in January of 2020. I saw foot doctors, I saw chiropractors, I saw, I took every root leaf mixture that Amazon sold that would absolutely cure your neuropathy type stuff. And of course, none of it worked. I couldn't get answers until I met Kim. So until
So
Rebecca,
how many doctors did you see in the beginning before your feet were actually checked? Do you remember? I mean,
I get pneumonia a couple of times a year, and I always saw a doctor for pneumonia. And and they're not perfect. The doctor that I trusted, I walked into the door, urgent care, walked into the door one day, through the door, and he said, you have severe crackles. I can hear them. And he checked with a stethoscope, and he had treated me before for pneumonia. But he said, there's something wrong. I want you to go over and get x-rays through the hospital system I just mentioned. I drove over and got x-rays. He put me on a medication he hates, but I like because it takes care of it. And anyway, he called me on a Saturday night. I was with Rebecca at her friend's house. He called me to tell me the x-rays came back absolutely negative. There was no pneumonia. Could he change my medication? And I said, sure. A week later, I was in urgent care for severe pneumonia with, a batch of tests and all sorts of trying to heal it. And they say to this day, I have a place in my right lung that's about this big from pneumonia. So you see a doctor, it doesn't seem to matter. And this doctor was just, he knew me. He really, really tried, but the x-rays came back negative. What do you do?
and in that, what the whole first part of the show was about, is it really truly about education? So like Rebecca said, she never heard about PAD all her experience. So how do we get the word out there in the medical community? How do we flood? Breast cancer, everybody knows. Cancer, everybody knows. Parkinson's now, remember 10 years ago, before Michael Fox got Parkinson's was not necessarily that big a deal. Look, Neil Diamond has it now, and he's talking about it all over the place now. So, and now you're having all these 5K walks, all these things with Parkinson's because it's out there. And I think that's where we are with PAD, is how do we get it out there? How do we get it out there in the community where it
is in the community. If you were on Facebook and you mention neuropathy, or you order stuff from Amazon that's supposed to help fix it, I get out of every 10 posts, 8 of them are from a neuropathy specialist. They come on in their white coats and they sit down, and they talk to you, and they show you their mother fell and nobody wanted to help her, and then they took it upon themselves. And then you have to watch a video that shows the body parts. And then at the end, they sell you a drug, not a drug, a gobbledygook of some pill. And it's normally $99, and you can buy it today for $69 if you hurry, because they're selling out quickly.
But it's that word, peripheral artery disease. Is it really truly out where it needs to be? And I think that's where, and I said it earlier, I think we're on the cusp of making a difference. But there is a big, and especially I think in the world we live in today, it's just a bigger hump than I think it needs to be. But we're just going to have to keep working and getting over that hump.
Well, here's a big problem too, and in fact, this kind of goes along with it. Like I had just responded to Kim about where she had said hers was found by accident on CT scan, and actually to this day, most cancer is also found completely accidentally when they're looking for something else. I have seen so many cases of where where a person was found to have a huge tumor in their abdomen. And the only reason they were brought to the emergency room was they were in a car accident and they were sent to have a CT scan, like of their back, to see if there were any, and then they'd see a humongous tumor in the body. So, and one of the problems, and it's likely the same, when you're looking at why am I not getting diagnosed with PAD and everything, in my experience these days, both personally and as being a nurse, unfortunately, no matter what type of doctor or medical issue you go to seek help for, the second that you're mentioning, you go in and you say, doctor, I want to have my foot checked, I'm having a lot of pain. Immediately, I feel like it's in 99% of the cases, you mention pain and they shut down and they're now assuming that you're there as a pain seeker, because everyone just, and I've seen a lot of nurses with this too, and it just disgusts me. And they treat the patient immediately as a pain seeker. They completely cut off. And you mentioned that you're there to find something out, but it's because you're having a lot of pain with it. And they immediately say, oh, this person's here seeking meds, and they shut off.
Yeah. See, I didn't know I had the atypical hypertrophic cardiomyopathy. I didn't know that till that doctor at St. Luke said we need to check your neck. Let's go ahead and check your neck. Let's go ahead and check your heart just to see what's going on. Because I never had really, it was all in my legs and all of that, and never really noticed anything necessarily with my heart. And then I went back for the test results, and he goes, do you know you have atypical cardiomyopathy? It's like, what the hell is that? It's like, no. I'm like, what? And he says, well, we need to do open heart surgery. And it was like, time out, hold on, slow down. What the hell are we talking about? How long would I have gone with that if he hadn't just said, well, let's just check everything else and see how it's going?
Yeah.
So I got lucky there in the sense that he goes, well, let's just check. Let's just see what you have going on. And, 4 months later, I had freaking open heart surgery and I had a myectomy. Did it save my life? Could I have had a widowmaker at some point? Because it was like when I saw the pictures of my heart, it was like, it was true. The whole left side of my heart was almost collapsed. It was so big. It was like, it's like, how much longer would I have gone if nobody noticed that before something really happened? And isn't that crazy? How many people Rebecca, how many people do have cancer out there that don't know? How many of us, how many PAD patients out there? I have I have a family member, breast cancer. She had a little spot. She said, I never really thought about it until it got, then she said at some point, my nurse, she said, the doctor said, let's just look. And she found out she had breast cancer, but she kind of blew it off a little bit because it was just a little lump. I remember walking and thinking, well, my back hurts. I just worked out too much. I pulled a muscle.
That's why most women die from heart attacks without seeking treatment, because it presents kind of differently in women most of the time anyways, and women will be more likely to write it off as, I was lifting boxes yesterday, it's my fault, I just need to rest, whatever, and then they're found dead from a heart attack.
I know. Oh, the insanity of it all. Welcome to life, right?
Mm-hmm.
It's crazy. Kim down there, she said it was the same way with her too. It was like, she said her doctor never checked her feet either.
Mm-hmm.
So it's, and how do we get doctors out there? It really, 2 minutes, it really takes less than 2 minutes to do that initial ABI with your fingers or with But how long does it really take to do a blood pressure cuff on one leg and then the other? She goes, check the neck as well. Yeah, I mean,
Yeah.
so that Dr. Walker, that's what I listened to one of his conferences the other day, and he goes, you know what? If you detect something wrong with the leg, we're trying to get people to check the whole body for it, because if some people it's not going to only show in the lower extremities, it'll be somewhere else too. So I mean,
And in answer to Kim's other paragraph about the gal that was finally diagnosed with stage 4 ovarian cancer, look at what happened to Princess Kate. You know, that's brought a lot of awareness to people all around the world. But you don't expect, you know, she'd had several kids, she'd been checked obviously through the years because of the babies. And all of a sudden she's, you know, she's there with full cancer of something. They won't tell us what, but you figure she's had medical care all this time. And suddenly
she probably had some of the best medical care that you and I want to touch because of who she is.
Yeah, exactly.
It'd be a good question to ask her. Did she blow it off? Did she just trust that doctor? Did she experience some of the same things, even though she's up there? Did she still experience some of the same things that we experience kind of down here? You know what I mean? I'm not talking bad about it, but you know what I mean.
Yeah.
Because the president gets better care than I do. That's a given, because he is the president. That's okay. I'm cool with that. But can he still experience some of the same things that we do? How many times? Wouldn't it be curious to ask President Biden, how many times did they pull you? When's the last time you had your shoes pulled off and your blood pressure checked in your feet? Have you ever had that done? Do they even think about that with him? I mean, so, and they're giving her a hard time because she's trying to hide it. So think about the pressure she's going through, and I remember explaining to my brother why I couldn't walk, and I know he looked at me like he couldn't grasp the reality why I couldn't walk to the mailbox.
Yeah.
You know, so.
And a big thing too is just you don't know what you don't know. I mean, even as a nurse, prior to all this happening with my mom, you know, even I thought if you're going to a cardiologist, you assume the cardiologist knows everything the same as every other cardiologist.
Yeah.
I didn't even, you know, you don't know what you don't know. So you don't even know that you should be asking questions. You just assume that everybody with the title of cardiologist all knows the exact same stuff.
And does that go to that question? How many doctors go to the new training? So you see these great big seminars, and there's only 30 people there from the whole state of Texas, when there's 100 doctors that need to be there in learning this new stuff too. So the old doctors, is it hard to teach new dogs new tricks? Are they really wanting to learn the new techniques?
No. I used to say that I always wanted to go to an older doctor rather than a new one fresh out of medical school, because they would have seen everything through the years of practice. But now I'm saying I'd rather go to somebody younger because they're up on the newer technology than the older doctors.
Yeah.
And yet the doctors get visits by pain pill pushers or by pill pushers constantly, because they're given samples. And, you know, and the pill is discussed with them. Oh, they know him by name, you know, hey, Sam, what have you got for me today? Well, I've got this new pill that just came out that will cure thyroid problems. Oh, okay, here, I'll give you some samples. And so they know there's a new drug out there, and they may look at it quickly to see who they can give it to. But, you know, it's not doing us any good. They're not learning other ways to treat the thyroid rather than just pushing pills.
Yeah, Rebecca, have you heard of Camzyos?
Have what?
Have you heard about the new drug Camzyos for heart?
No, but I haven't really, I'm not practicing nursing right now, thank goodness. So I haven't really kept up on all of them.
But it's a new pill out for, and that is addressing cardiomyopathy, and everybody's trying to get on it now. But you have to fit a certain criteria to be able to take it. But everybody wants it now.
Come here, Bailey. Turn around.
Okay. Well, one of the things, well, I was just going to say something and I forgot it. Everybody thinks that neuropathy is, or even PAD, I think to some degree, is part of being diabetic. I've never been diabetic. I'm not diabetic now, but that's the first question I get asked. And when they say no, they go, oh, she's going to be kind of difficult to work with. If she were, diabetic, then we can just blame it on that and just feed her more medicine. But I've gotten that a lot through my ages. When I sit down with a doctor, the first thing they look at what the nurse has written about me, and they say, oh, you're not diabetic.
Are you an ex-smoker?
Nope.
So here's a question, Nancy. Have you ever sat down and thought, what did I do wrong? Why do I deserve this?
Yeah.
What did I do wrong?
And in some ways, I think that that's even further delayed her care was they would say, are you diabetic? And if she said no, then they would assume it wasn't certain things.
Mm-hmm.
I feel like almost if she was diabetic, then they may have looked for other things, but they said, oh, well, you don't have any of the risk factors for it. So, so they didn't look further into it.
And to be fair to all the people that I've seen through all the medical people, every single year I had where they would come in, and some brought them in, on purpose. Some offices brought them in where they would come in with that machine. They put gluey stuff on your legs, and then they rub the laser thing up and down the legs to listen for. And every single year it was fine until the third year, 2 years ago. And all of a sudden the right leg was bad. But then I still didn't get any treatment until Rebecca got hold of Kim. I didn't get to see the doctors I should have seen way back when. So,
and is that it's same thing with, so if I walk in and say I'm a smoker, does that automatically put me in a category where I'm an ex-smoker? Or I unfortunately I still kind of smoke. When I first got 4 years ago, first saw my primary, said, Doug, you got to quit. All right. But so did I get put in a different category because I was a smoker?
Absolutely.
Yeah, because in her case, not a smoker, not a drinker, no high cholesterol, nothing like that. So I think they were more likely to just say to her, well, you're just getting older, you're having aches and pains.
I'm
Have a good day.
77, so that's
because they didn't see any of the major risk factors. Forget that just aging itself is a risk factor for PAD. But because she didn't have diabetes, she didn't smoke, didn't drink, didn't have high cholesterol and everything, they just said, well, you're not at risk.
Yeah. And Kim said something about dementia. My worst fear is that word. So if I forget something, and that's where automatically my mind goes today, because dementia runs in my family. So it's like, that's my worst fear, is I don't want to get dementia. And if, what am I going to do if I get it? But it's like, what do I do if I can't walk to the end of the driveway and get my mail or and another one is, I don't put my phone on vibrate.
Yeah.
Because every time it vibrates, I think my defibrillator is going off. So it's like I don't put my phone on vibrate. So, Nancy, I think that's why it's good for us to talk about the stress. The stress is the one I think I've personally been hearing a lot about people addressing with me the stress part about this whole process that we go through every day and all the things that come along with the stress. Mm-hmm. One of the ladies, her husband was just diagnosed with Parkinson's. One of the other ladies, her husband was stage 3 prostate cancer. Now she's his caretaker, but she has PAD at the same time, trying to get her legs taken care of. And she said, I don't know if I'm coming, if I'm going, if I'm awake, if I'm not awake sometimes because of everything. She said, we still have to pay bills.
Mm-hmm. Yeah. I don't think it's stress. I know a lot of people talk about stress. What I do think is it's ginger ale, sodas.
Well, no, but it causes stress. It causes stress having the issue.
If you're talking about medical stress versus, stress on the body, stress on that kind of a thing, I'm saying.
Yeah.
So does stress, depression, like Kim said, depression, any of that, all that affects us physically as much as it does emotionally and psychologically. If I'm in a bad mood and I have a little bitty toothache or I stub my toe, that bad mood exaggerates. And I can't say that word half the time. So it's that.
Yeah, but how about here in Arizona, they just found another city that has lead in the water. There's so much in our environment that's totally bad for us. I think that's, stress. We've all had stress, but I don't think that it causes the.
Yes, it can. It can. Stress can cause bad health. And then when you have the bad health, it stresses you even more.
It stresses you more,
That's why like your serial murderers and bank robbers and all that are never caught, people who have done horrific stuff, they'll live to be 120 and they never have any medical issues because they have no conscience. They're not stressed out over anything.
Miller Creek Road.
What's that, Kim?
Turn right onto Miller Creek Road.
Yeah, it's me. Sorry. I'm on the road.
Take a right
turn.
Creek Road.
Yeah, I was trying to figure out how I can still be participate, but I guess if I have my GPS going,
mile, turn left onto the US 101 North Ramp.
I don't know.
Santa Rosa,
I can't keep it off mute, so.
No, you're fine. But yeah, Nancy, stress stress does affect you physically. It can affect you emotionally. And so if you get depressed, and all I do is sit on the couch and I eat potato chips, well then physically, if I'm depressed because of my condition and I feel like, why am I going through all this? And I'm not going to do none. I'm just going to sit here and I don't walk. What happens then? I don't build collaterals. And as long as I'm not walking and not building collaterals, I go to the doctor, I lose my leg. Well, then it just adds to that depression, doesn't it?
Yeah.
They say for public speaking, how difficult that is for so many people.
Public speaking?
Yes. So if you have to get up and do any public speaking, they say let that anxiety or energy that you have, use that to your advantage.
Right.
And I think, and of course I have stress like anybody else, but as far as my PAD stress, I try to use it to my advantage. When I'm getting worried or upset about it, I go for a walk. even when my leg was hurting, it might be a small walk, but I would use that negative energy instead of grabbing the potato chips. I would use it and, or go chop some vegetables. You know what I mean? I think there are tools that, just like we talk about the doctors that has the right tools in his tool chest, we need to have the right tools in our tool chest.
And absolutely. How well do you do if you were addressed in public speaking? Do you do well with that?
Well, I mean, I get nervous like anybody else, but I've done a lot of public speaking. I just try to pretend I focus on one face in the crowd. I mean, I really wasn't talking about public speaking, but I use that as an analogy, and
it's the same. Can you imagine what Kim goes through? So she's on national TV, ABC, with 10 million people watching. I hope I don't say the wrong thing. I hope shit doesn't come out when it's not supposed to.
Kim has a lot of tools in her tool chest. So
yeah, except I almost peed myself when Dr. Phillips turns the freaking show on me, and I suck at being out of control. I got into this because I was so shy. I cannot talk to people. I struggle with talking to people in a general sense. I can't do small talk to save my life. I freeze. It's
in
awful.
half a mile. Use the right two lanes
I don't
to exit 4608
like
for California
being
37
sorry.
Napa, Vallejo.
I don't like being on the receiving end of questions and talking about myself. And I have to remember, and Douglas always reminds me, Kim, it's not about you, it's about everyone else you're helping. So don't think about
Use
it.
The
but
right two lanes
I
to
get
exit 4608.
Very self-conscious when it comes to speaking about even stuff I'm doing to help others, because
continue
it's
for 8 miles.
Me talking about it. I would rather talk about other people, and I would rather talk and ask questions of other people and find out about them. I'm good at doing that. I like doing that.
But Kim, you get up and address conferences and all over the place. It's just you go in prepared.
I go in prepared.
I think
literally,
as patients, have to not only prepare ourselves for doctor visits and, for all the other things, but we have to prepare ourselves for the time when we feel low, for the time when we feel pain. Not
Correct.
that, it's a do all be all, it's just gonna make it go away. Cause if it was that easy, we wouldn't be here. But I think we need to have some tools in our toolboxes to help ourselves also.
And that's why we bring that up, though, I put that video out there about there was a lot of people posting about being bored. And I spent $22 at Walmart and bought 8 different things. And I made a little video about drawing, putting puzzles together with your kids, about I bought a cheap birdhouse, and that's what I did with my mom with Alzheimer's. We painted dollar birdhouses. So how can you claim if you're bored when there's so much out there you could do? But getting people to that point is the process. And that's why Nancy and I talked about bringing that up, so we could get that information out there to people, because some people don't know about that stuff. I mean,
yeah, they just don't think about it.
Yeah, because if I got up in front of 20 of when I was an LCDC, state licensed chemical dependency counselor, I got up at 20 of my peers, I would stumble. My stutter would be a little worse. But you put me in a room full of 100 addicts, and there's no problem whatsoever.
And one of the things that we do, and also Douglas does now as well through our Lifesaver hotline, and not many people take advantage of this service that we provide, which is to do exactly as you're saying, is prepare for these appointments, prepare for these moments. We sit down and we have an appointment preparation form, and we sit there with you and we go through, and I've spent hours actually with different people putting these appointment preparation forms together so that they're ready with the right questions. If they can't ask them themselves all attend the appointment with them, as even Marcia knows, Douglas knows, is I get on the phone during the appointments and I help to take notes and also ask the questions that maybe they don't think of or are uncomfortable asking, during those appointments. And so we're there, we do it for free. And it's really helpful for those that, we even had one person, Sherry, who's in the group, and she was on deck for an axillo femoral bypass, like what Douglas had. And we spent about an hour role playing because I wasn't going to be able to be on the phone during that call because she was in South Africa and it was, not possible in the room. And so we practiced back and forth every scenario, what the doctor would say, what she was going to say back. And she got the confidence to be able to say, hey, doc, nope, not doing this. What about this? What about that? And she ended up not having the bypass. And the doctor was able to use wires and balloons to open her up. Whereas her roommate that was there ended up with the axillo bifemoral bypass because the fellows had just learned how to do it. And so they were really big on it. So everyone that was presenting with that, indication for that particular bypass, they were just doing it one after the other. But Sherry avoided it.
Sharing that experience with each other. What about the lady in Florida also that was fixing to have it done? And I shared my experience with her. And 2 days later, you got her to another doctor and he was able to go through her leg. So it's like, and I think that's that part about, I remember in the very beginning, I didn't know what I know now. And I still have moments at the doctor's that I'm glad Kim is there or my brother's there because my mind's going 1,000 miles an hour. And I'm trying to keep up with everything. And if he's using big words or if I'm a little bit stressed or I drove 2 hours to Houston in the Houston traffic and all of that. And it is nice to have that person there with me in case I miss something. Because I'm not always going to be on the top of my game as a patient sitting in front of the doctor trying to think of 1,000 things I'm supposed to ask.
Yeah.
So it is nice having that word advocate there to help me get through some of those circumstances. And that's what I think we all do with each other and can help each other in these hour classes.
I agree. And you know what, if Rebecca is still here, I actually, Rebecca, it's so refreshing and so amazing. And I wish I was one of your patients with you being a nurse, just because what's great is that we have quite a few patients that have come our way that have family and, close friends or whatever, or brother, sister, uncle, cousin, whatever, that are nurses or doctors or whatever in different things, but don't necessarily have experience with PAD. But because they're doctors or nurses or whatever, they blindly trust their friends who treat PAD. They're like, oh, he's a good person. He's a great doctor. I know him. I work with him in the hospital. They're highly regarded, highly rated. Well, you know what? They just have a big ego, right? How does this person
In half a mile, use the left 2 lanes to turn left onto California 121 North.
How is it that someone who has not been in the cath lab with that doctor know exactly the outcomes?
Right.
Know exactly what the tools and techniques are. And it's great that you reached out and you're like, you know what? I want to learn more. I want to know this stuff. I'm not going to make the decision and send her to some doctor just because they're highly rated at my hospital. I don't know the skills that are necessary. And it speaks volumes to your character that you're like, you know what? I know that it takes different skills. I know there have to be different options out there, and I'm going to explore them. I'm not just going to rest on my laurels and say, oh, we have a bunch of doctors here. They must be good. They work at the hospital. I know that, yes, they must be good, but does it mean that they're necessarily specializing in extra special techniques that maybe my mom might need? And I think that is amazing.
Use the left 2 lanes to turn left.
Yeah, I mean, when I worked at the cardiac or in the hospital at the cardiac unit, we had 4 cardiologists. And at the time I would have said like, oh, they're wonderful cardiologists, but now I just realize I didn't even know that I should be comparing it to anything. For all I know, none of them were good cardiologists. You just assume they're cardiologists, they work at the hospital, you see patients go for procedures that are successful, and I was just assuming, okay, they must be good. But, it's scary to look back and say, I don't really know that they were.
It that white coat syndrome, just because they have the coat, that little name tag. We all know they went through 12 years of school, and so they just got to they got to be it.
Well, and mostly just what I said, earlier, even as a nurse, I'm just now learning that even if they're all called cardiologists, they might have different skill sets. I just assumed if a doctor had the title of cardiologist, that they all knew exactly the same stuff.
That's when you said that, I think about Dr. Walker. He rolled across the room. He was on that little stool, put his hand on my leg, and he said, Mr. Salisbury, if you had seen me 2 years ago, you would not have had all these surgeries because of what we know now that we could have done in the very beginning, where you wouldn't have had the aorta bifemoral bypass. Now you have the axial bifemoral bypass that's causing all these issues. You wouldn't have had probably, we could have done things. They never went through your foot. No, I never heard about that. But so it was like, did Dr. O just do only things that he knew how to do?
Well, yeah,
And I would
right.
have to, I'd have to ask him, did you ever go to any other trainings, Dr. O? Did you go to any trainings whatsoever? Or did you just rely on what you know and what you trust? That's it. So it's like that morning, Grady's on the forklift. I've told this story before. Grady's on that forklift, and the whole point I was going, he was just going to do stents. He was just going to do stents. And he called and said, I can't get through. We got to do this axial bifemoral bypass or he's going to lose his leg. My brother will tell you, what the hell am I supposed to say? So at that point, and that's where I learned from Dr. Walker, well, why didn't he try through the foot? Why didn't he try this? Why didn't he try this? And it's like, I'd have to ask Doctor, is this the only thing you knew that you couldn't get through, so you're just going to do the axial and move on?
Mm-hmm.
And the reason why I say that is I went back after I met Kim and everybody. I had one meeting with him, and I told him some of the things that was going on. He said, I got my job. You got blood flow in that area. Whether it's blocked now or not, it had nothing to do with it. I did my job. See you later. So it's like, it does make you wonder, so you couldn't get through, you weren't going to try anything else. So it was just easier to make 2-hour job money and send me down the road.
Mm-hmm.
Is that part of
Cameron.
that?
No, I thought you were done, Douglas. Sorry.
Go
I'm
ahead.
here.
Oh, I was going to ask a question, but it's not related to that.
Go ahead.
I wanted to ask, and maybe are you a nurse, Rebecca?
Mm-hmm. Not
Yeah.
currently practicing, but I have in the past.
Oh, well, that's all right. I was curious. So we celebrated Easter today, and I ate things that I normally don't eat. I do pretty good on my diet, but not today. Anyway, so I had some dessert and had, some, I don't know, sugary stuff. And I just was trying to exercise, and I noticed it's extra painful right now. Can sugar act that quick or cause that reaction? You have sugar and it makes your leg hurt more?
Yeah, I mean, it could, sugar can definitely, that's why we talk about sugar highs all the time. Sugar can affect your body instantly.
Wow. I mean, it can make my leg hurt that quickly?
Yeah, I don't, I don't know if there's any specific things, but yeah, sugar can affect your body within seconds of, and just like anything, like, I would never tell a patient to never eat sugar, just do it in moderation, or, you just have to notice if it affects, some people, if they eat a little bit of sugar at night, they can't sleep for 2 days. It affects everybody differently, but it can affect you within seconds. And it's
But
just,
Does it cause leg pain though? I mean, I guess I'm asking about that specifically.
Well,
Of course,
I'm
I know.
wondering, Marcia, just in terms of, and Rebecca, jump in. What I've seen is, I'm curious if you drank less water. When you're eating that stuff, a lot of people don't think of drinking more water. So some of it's the food, but then on top of it, because you're eating more food, that then you're not keeping up with your intake of water to flush things through.
It's
Oh,
complicating.
you know what?
Yeah,
I
it's
wasn't.
complicating factors.
Yeah, I wasn't. I was so excited about eating all that bad food. I was just shoveling it today.
But
When I came home,
in there also that part. So if I eat good for 6 months, and she eats very good on, but she does. So if I eat that good 6 months, and then one day, in there like a shot thing to your system also, where, so I haven't had sugar or Dr. Pepper in 6 months, and I have a Dr. Pepper in there. Also, I've heard there's a shot to the system if you've been eating well, and all of a sudden you don't eat bad, like your stomach gets upset or.
Yeah.
I mean, for example, I just had I don't eat a lot of fatty foods and such, and we eat really healthy. And last night, my dad and I went to this other restaurant, and it was a brand new restaurant. We tried it out, and I have a thing for those. If they have corn tortillas with short ribs in it, and then they fry it, and then you dip it in the consomme sauce or whatever.
Yeah.
Oh my God. Yes, that's what it was. And I'm going to tell you, it tasted so good. It was absolutely delicious. But afterwards, it just sat in my stomach, and it never did before. I used to eat them all the time when I was in college. And now, because I don't eat that stuff, I don't eat all the fried foods. And it sat in my stomach. I swear. I was like, oh.
Yeah, it's
but I enjoyed every bite.
Yeah, it's the same thing with me. For me with caffeine, like for years and years, I mean, I could drink like 6 to 12 Diet Pepsis a day and be just fine. And then eventually, for whatever reason, I just kind of started falling off of drinking it, and I just stopped drinking it. And once I went without caffeine for a while, even if I bought like one of those even little mini cans of Diet Pepsi and drank it, I would be jittery for 2 days. And it never used to do that for me. But once I stopped drinking it, I can't tolerate it anymore.
Wow. So can sugar get in the bloodstream, like to the leg that quickly?
It can get everywhere.
I mean, I can see how like those Barilla tacos could do that, because as soon as it hits your stomach, it's like,
oh yeah.
But I didn't know sugar could do that.
So do you
But I
think
still
you
wonder if it's the
more than
sugar
you
or if
think,
it's lack of water.
And the lack of water could be a definite complicating factor, because that's the same thing with salt. When people eat really salty food, but they're not drinking water.
Right.
Yeah, the water, because the water really helps flush everything through your system better. And yeah, I'll see people like, hot summer day, and they'll be eating chips and really salty foods and everything, and drink no water, and it affects them huge because of that.
I've heard about the salt and water. Yes, I have heard that. Yes.
For
I
any
didn't
of
know
you
about
ladies,
the sugar.
Huh.
Go ahead.
For any of the ladies here who may be menopausal, I'll tell you what, salt was just a killer for me. And I gave up salt when I was going through that, and I quit having night sweats.
That makes sense.
It was incredible.
There was this one, of course, I was a pizzaholic, and this is before I knew I had PAD. But there's this one pizza place, and the pizza was always so salty. And I realized that whenever I had it that night, I didn't sleep. And I was like, what is that? And it was just a matter of deduction, but it was the salt. I quit eating it, and I quit eating other salt, and it went away.
That makes a
And
lot
you
of
don't
sense.
use a lot of salt now, do you?
No, I use herbs. Yeah, I use herbs, not because of the sweating so much, but because I just don't think sodium. We get plenty of sodium. If you have any processed food, which I don't eat a lot of processed food either, but it sneaks in small little ways. You have a granola bar or something, you're getting sodium. It's in everything. If they're not, and especially if they're not putting fat in it, then you can guarantee they're putting sodium in it. Because otherwise people would say it tasted like cardboard and nobody would buy anything.
I hadn't heard that one.
Oh yeah, it's either fat or sodium. I mean, you're not going to find anything that comes in a box that doesn't either isn't high fat or isn't high sodium, generally speaking.
Salt, for me, salt. There's not a salt in this trailer anymore. So, and I noticed since I've been not using it, that my food does taste different than all the way around. Everything I eat now, I used to put salt on everything. I put a little bit of salt and pepper on literally everything that went into my stomach. Maybe not,
I use
but
a ton of pepper. Douglas pepper's not bad for you, and garlic and herbs. Yum. And once you quit smoking too, you can actually taste food again. I think that's another thing is with smokers, they can't taste the food, so they're using a ton of salt.
And I hated when people say I can smell it a mile away, and until I quit, I noticed the other day I was sitting somewhere and somebody walked by, and I said they've been smoking. And I used to think I couldn't tell that, but I could. I mean, they walked by and it was like they smelled like a Marlboro 100.
Yeah.
I grew up in an old part of Virginia, and we had salt cellars at our table, at our plates, each one of us at the table in my family, and we would cut a piece of meat and then dip it in the salt. And oh
wow.
When I was on a farm, so we used to use salt crystals to keep weeds down or something, and I would pack a bunch of them in my I couldn't wear pants back then, you had to wear dresses, but anyway, I'd pack them into my school thing and take them with me and suck on them all day. So, and I gave
why what did that do? I mean, was it for the taste? Was it for
the taste of it? But through the years, I got so I didn't use salt at all. And when my mother came to visit, she said, "Ooh, your food doesn't have any salt." I had stopped using it even to cook. So, and I really use very little now. If I use salt, I have a little shaker of popcorn salt. So it's ground up salt. So I just use a very tiny bit of it. But
somebody was telling me about sea salt, about pink salt. There's some other kind of salt that they were telling me there's all different kinds of salts you can use out there.
Yeah, but
I don't know if they all mean I have
and also salt is salt is a preservative. So I'm thinking, I mean, I don't think you're as old as this, but way back in the day, or farmers or whatnot, they would use salt as a preservative. And so, and when money was tight, like during the Depression or whatever, they probably were using salt as a way to preserve food to last longer. And so it became part of their diet that they expected and appreciated. You know what I mean? Versus a mineral that our body needs a certain amount of.
My papa died
I don't
at
know.
the age of 98. He ate bacon. Mama was a fried food connoisseur, and he ate that every day, and he was in the best health of his until 98. And it's like, did I miss a boat there
What did he
somewhere?
do?
Or
What did he do for a living?
he worked at Exxon for
People
6
say that,
years.
but you know what? Doing what, Douglas? Not
He was
sitting at a desk, I bet.
he was an engineer, so he was out in the field,
Huh.
but he worked at the same
Interesting.
Exxon for 60 years. Now, here's the question then would be,
Huh.
I wonder if they ever checked his feet. I wonder if any doctor ever checked his feet. I wonder if he ever went to I know he went to doctors, but did he ever go to a doctor, and did a doctor ever once check his heart to see if there was any blockage of any type? But he died at the age of 98, and he ate that. Mama and Papa ate healthy every day.
Yeah, but the thing is, Douglas, people say that, but you have to think about our culture too. Like, they weren't sitting on Zooms for an entire Saturday, right?
Which is true.
They weren't sitting at a computer playing games, every night, all night long. I mean, they were more active. Even if they thought they were sedentary, they probably were far more active than the general population today.
Papa was always out there
if you're
working on the
exercising, you can.
pickup.
Right. He was probably always doing something. So your body needs, the more it does, the more your body needs. I mean, he was probably burning through a lot of that.
Because she made the best
versus
chicken
just
and
somebody who's
dumplings.
on the computer.
You're right. Think about it, in 10 years, they're trying this new meat out now. That they had I ate lunch with a friend at this restaurant here, and she had like an armadillo burger. It was a different type of meat. She said, "Take a bite." I took a bite, and it tasted like roadkill. And we're like, "No, sorry, I'm gonna stick with my chicken."
And I live on a farm, and I put out salt blocks. You know what a salt block is? You probably do.
I do.
Yeah. So, and they go pretty quick. I have a lot of deer, but I wonder what it is in the deer that they require their body that sodium. They're made differently, obviously, than we are.
I don't
Head
know
north
about
toward
that.
California 121 north.
One thing I wanted to
Turn
add
right
just on
onto
the
California
salt.
121
Just
north.
give me a second till my
Continue on
GPS
California
turns here.
north for 9 miles.
Sorry. One of the things with the salt, my dad has a functional medicine practitioner and also a dietitian with a PhD. And so he this is a dangerous intersection here. And they actually both have him on Celtic salt. They told him that when they tell you that sodium causes high blood pressure and that kind of thing, they claim that's a different type of sodium, and it is way too much because it's processed foods. But what you want is the Celtic salt, because our bodies actually need salt, and too many people are either eating too much through processed foods and not the right salt, and then they cut completely out, and then they have a problem like my dad where his sodium is low, and so he has to replace it with Celtic salt. So they have him, and they both agreed that he needs to take a pinch of Celtic salt a day, just plain.
That's with the K.
with a C, Celtic.
Okay.
Celtic.
I've never heard of it.
I hadn't either. And you can get it, you can grind it yourself, which is great. But my dad was able to raise his sodium back to normal levels, and he's not overdoing it at all, and it's worked. So a little surprising. There's a book that I know, Marcia, you would love to read it. It's called The Salt Fix, and it's how our lack of salt actually has led to part of this diabetes epidemic. So we're replacing the salt with sugars. So just a little something interesting.
Replacing
Douglas, I think
salt
you would
with
like
what?
it too.
I'm looking up.
With sugars. And Rebecca, actually, you and Nancy, and you guys would enjoy the book too. It's really interesting. I just started reading it.
And it was called The Salt Block?
The Salt Fix.
Oh, The Salt Fix.
Maybe we can Olive. I don't know if everyone
Here
wants
it's
to get that
saying-
book.
Here it's
But we
saying
could all
that
read it.
the Celtic salt is from the Celtic Sea off the coast of
Okay.
France. It
You know,
contains
because
92 trace minerals.
Yeah, they said there are so many minerals in it, and they say that we actually, since we came from the waters, kind of like the oceans, that we require a certain amount of salt, and we're not getting that right pure salt that we would be getting.
I was
So I thought that was
I use Muldoon. Is it Muldoon? What's the name of that salt? It's I think it's called Muldoon. Do you guys know? Have you heard of that?
no.
Because I don't know that much about salt, but like, if you just buy the salt and, the regular salt, it's iodized, and I don't know what all that does, but it's not supposed to be good for you.
I was using sea
I'll look for
salt
this
because
book.
somebody told me sea salt was the best for you. And then somebody told me pink salt. And then there was another salt they told me, but I can't remember. And I just didn't buy. I was at the store one here a while back, and I haven't bought Himalayan salt. That's it. Yes. Thank you, Kim. It was Himalayan salt. I haven't bought salt, and I just don't use salt anymore. And it has made the food taste different, but I just tried to stop using it altogether. So, I mean, learn something about salt and sugar.
Yeah, it's interesting. I use the Himalayan salt. I heard that was good too. I have to admit, I haven't done that much research on it. It's nice when you can find, certain people and then they agree on it, having a dietitian that has a PhD, and then having and she's always on the cutting edge trying to learn and is research oriented. And then having, actually 2 functional medicine practitioners. We have one who's a nurse practitioner and functional medicine practitioner. Hey, Douglas, can you do me a favor? Can you share the Zoom link with Debbie Louise? Debbie Louise, I think, needs to talk to someone, but I can't get to her because I'm in the car and she's trying to call in to me. If you can let her know we're on Zoom and see if you can get her on Zoom.
Reported ahead on Fremont Drive.
Oops, are you guys still there?
Yes.
Okay.
She's from Lancaster, isn't she?
Yeah, in England.
Yeah.
But we should get Douglas. We need to get the nurse practitioner on, who is the functional medicine practitioner. Whoops. Oh, shit. Oh. Wasn't paying attention.
See if Kim gets this recalculating.
Recalculating. I know. I just ran a red light.
Oh, and we're all witnesses.
You are. Oh my God. I don't know.
We won't
I'm
tell.
so stupid. That was so stupid. Oh my God.
We've all
And
done.
then there's a highway patrol up here that I'm like, that I'm literally, God, if he was only right back there a little bit further. Thank God. Should I pull over and tell him that I did this? You come around a corner and it literally, and I'm not used to wearing this, is my first time actually driving with my new prescription sunglasses. And I don't know. Everyone, you guys are pure witness. I just broke the law. I hope Josh does not share this.
Take that part out, Josh.
Live on Zoom. Thank goodness I knew there was a reason why we didn't broadcast on YouTube today. Holy cow, that just was stupid. Boy. Anyway, back to SALT. Douglas, remind me, we'll get the nurse practitioner on so she can answer some of these other questions.
Because that is a good topic for us to.
Yeah, that would be awesome.
I think SALT. And maybe we could get the author of that book. I wonder if the author of the book, I don't know when it was written. But if anyone can find some contact information of that author, that would be great.
That would. Because that is something that I wonder how many people in the group use too much salt. Because I know I used to at one time for sure. But now.
A great conversation is about alternatives, right? Douglas, you found alternatives, and Marsh even helped with some of it.
Well, it's like I don't eat white bread anymore. I don't eat bread. I have those flour tortillas that are healthy, but I haven't bought white bread or wheat bread or any bread lately. So I mean, I had to admit, I did have some macaroni and cheese the other day, and I didn't eat the whole box.
Well, see, that's even a start. If you used to eat the whole box, and now you didn't eat the whole box.
So I mean,
you know what I found is really great other than salt is red chili flakes. And it adds, it makes it a little bit spicy, but it doesn't, I'm sensitive to spice, so I can't handle a lot of spice. But it really, when I don't use that much salt in I get natural bone broth, so it's not salted. When I make soups, one of them was kind of bland. And the first thing you want to do is add salt, but instead I decided to add some chili flakes. And when I reheated it in the microwave, oh my God, it made a huge difference. It made it so delicious and flavorful.
I'm trying to get Debbie on.
Okay. Marcia uses some alternatives. I know that Mrs. Dash is really great. I use a lot of garlic. Garlic replaces kind of that need for additional salt, right? So good.
Me too. I love garlic. And another thing I like, but everybody's different, I like thyme. Like if you're having really anything savory, thyme is so good. Or with eggs, thyme really good. But it depends on your I think all herbs are worth playing with, and onions. Onions are the same. Green onions, you know, the long ones, round onions, chives. Yeah.
In a quarter mile, use any lane to turn left onto California 121 North, California 29.
I had to order some liquid stuff the other day because I'm out of. I used that last thing of liquid.
You said you ordered some. Did you get it?
Yeah, I used it up.
The second one?
I did. I got this. Got the small bottle, but this time I ordered the bigger one. Cause I'm every pot I use on Instapot, I'm putting it in it now. Cause I like it.
What is it?
Yeah, I'm glad you do. So there's
It's
this product. I sent some to Douglas. It's called Wright's, WRIGHT, Wright's Liquid Smoke. And it doesn't have any salt in it. And there's another brand of liquid smoke, and it's all artificial.
Okay.
And this is just the drippings of smoke.
Okay.
Vape, like water, and just the liquid. And a little bit goes a long way. Like, it's a small bottle, and a couple of drops really will do it.
Okay.
But it makes it taste like you've barbecued something. It adds so much flavor, and I used that a lot when I was first learning how to change my diet and get rid of the fat and the salt and the unhealthy things. And Douglas likes it. I'm so glad.
Yeah, awesome.
Do you see it?
Mm-hmm. Yeah, I can see it. Yeah, I wrote it down.
Now, be sure, though, that you look for Wright and not, I forget what the other brand is.
Definitely.
Because they're not the
another
same.
brand, so make sure you get the liquid, that one, and not the other one.
Okay, that makes sense.
And I
It's
use
really good.
a lot, and I put it in my Instapot with my chicken.
Oh, that's a good idea.
Even when I did stir fry rice, and I put it in the stir fry rice.
I'll stir fry veggies. Yeah. It's really good. And sometimes if I like, I like ground beef, so I get 90% lean.
Right.
And when you take all the fat out, there's not a lot of flavor left. So sometimes when I'll make burger patties and stick them in the freezer. So I'm single and I can just pull one or two out. And so I might mix a drop or two of that in with them. And it just gives it some extra flavor, kind of like you barbecued it.
Okay, awesome.
But a little goes a long way. So it's, like a lot of things, it's easier to add more than it is to take it out.
It away.
If you like it, let us know.
I will for sure.
Douglas, where did you order it from? From Amazon? Did they have it?
I got it off of Amazon.
Yeah, I found it on Amazon.
Oh, good.
And I mean, look at that. But I put it on everything, Rebecca, and it just does make everything. It really does. I like it on everything basically now.
On the list of ingredients, what does it say, Douglas?
Let's see. Let me get it. It is. The front of it says gluten-free, non-GMO, and it is. Well, it says ingredients: water, natural hickory smoke flavor, and it says it comes from New Jersey.
Yeah, if you look at the other brands that you might find on Instagram or on Amazon, look and see what their ingredients are.
Yeah, it's all artificial stuff.
Yeah.
You'll have to get over it. It's a Yankee product, but that's okay. If it comes from New Jersey, it's a Yankee product, but that's okay because
That's
it's pretty good.
hilarious.
I read how they discovered it, and it was some story. I forget it exactly, but it was like when they barbecued down in the basement where the condensation was or whatever, it would drip. And I don't know if something was eating it, like the cats or something, and they were like, "What is this?" And so they discovered, oh, well, we can bottle that.
That's awesome.
Well,
And I know, I just am curious. I know this is a little, Debbie Downer, but I just wonder if it's toxic just because it's coming from smoke and it's burned. Like it's
Oh.
no, that's the only thing I wonder is if, because when you're burning stuff, right, you're inhaling it, it goes into your lungs and it and they say anything you burn is toxic. That's why they say don't like fry your stuff. But I wonder if smoking it and there's smoke and you get the condensation of it, is that toxic? I don't know.
Well, if you think though too, Kim, if you say you bake chicken with foil on it, it keeps moisture in, it creates condensation.
Yeah.
And that flavor, that's flavoring, but it wasn't burned. It was baked. It's like cooking liquid, but I don't know. That's a good point.
I have no idea. I'm just thinking about it, but you bring up another good point. Well, is it just the flavoring gets in there? I don't know.
Yeah,
the guy
I pulled
around
it
the
up on.
corner who does the deer meat. He keeps everything. He uses it for everything.
But so Rebecca, what did you find out?
I pulled it up on Google, and a few of them, a few different sites say, however, there are certain downsides to it as well. Liquid smoke is not a healthy ingredient. It contains harmful compounds like PAHs, which is carcinogenic.
I wonder if that's right or if that's some of the ones because it's all
I know. So it might, it might be different ones.
Huh.
Yeah.
Well, great.
And then,
great.
Yeah, another
now
site
is trying to poison me. Oh man.
But you have to think also it could be it's healthier than
exactly. Is it the lesser of evils?
Right.
It's like honestly, even chewing gum these days has cancer warnings on it.
Yeah.
But really, how many people do you think have really come down with major cancer from chewing gum? Everything has everything has warnings.
Bubblicious is cancer causing. Really?
I'm wondering, since you're already on Amazon, check on one of my favorite things is the coconut wraps.
Oh.
And I use those all the time. I get the ones that are turmeric coconut wraps. And then if I'm, getting a sweet tooth and I get some coconut whipped cream and some berries and I get these cinnamon coconut wraps and I have that for a dessert. But, on the side, is that healthy? Well, it's healthier.
Yeah.
And, it's just
Kim,
like along the lines
if we were to do that, Kim, how are we supposed to eat completely unless we go completely vegan or vegetarian? I mean,
even then, is that healthy for everybody? Not necessarily. Like
no,
my dad.
I had a friend that went completely vegan for health reasons, not for anything else. But she started having terrible medical conditions and she was losing all of her hair. And her doctors said, no, get back off of that.
I know a lady who's a vegan and she's more sick than anybody I ever know for all kinds of stuff. It is like, you need a hamburger. Go buy you a hamburger once a month and eat a hamburger.
Because I've seen documentaries and stuff where there are really hardcore vegans that literally figure out like a chemist. And so they find like the nutrients that you have to have, they find it through like powders and that kind of thing. But even then, I think it's just, yeah, they still mention a lot of problems with it.
But if you have to eat powders and stuff, is that meant, and I'm asking this and genuinely, out of curiosity, if you have to source those nutrients through powders and such because it's not at our fingertips, is that really what we were meant to do? Or are we truly hunters and gatherers?
Everything I've
have
ever
no
read
idea.
says, everything I've ever read says is that we're hunters and gatherers, that we have to have some meat.
And can you get everything you're supposed to get through, like blueberries, through a peel? Yeah, so I ate blueberries at 2 o'clock last night. I couldn't sleep. And I had a whole handful of blueberries, and I didn't think I liked blueberries till I met Kim and tried them, and I love them now. And it's like, but so if I eat the little blueberries from I get HEB, is it the same as getting it through a powder or a peel?
I don't think so, because they have all sorts of natural natural things in there. I don't know that you can get it exactly like that.
Why don't just go buy the Nature's Balance and get everything I need from just taking pills?
Well, you're
But
not
you can
getting
get
the fiber
them.
and the minerals and all the other things that go with eating a blueberry that you are if you took a blueberry pill.
Well,
Yeah.
except that there are some that have the actual extract and they just take the blueberries and they dry them out and you get the whole blueberry. And you actually, when you break it down to a powder, I don't know if it's absorbed in the same way. Marie's mom is a naturalist and she, sources some of the things through that. We were able to get some blueberry capsules. And I'm wondering with Marie, and in terms of she's been taking them, and not only is she moving more and she's in the water and she's doing it and her feet look much better today, I wonder if maybe those blueberry capsules and some other things that she's doing are actually working for her.
Maybe, but when you dry fruit, you also heighten the sugar. I mean, a raisin has far more sugar, right, than a grape, I think. Dried blueberries, I know, are higher in sugar than a blueberry. So when they make it a powder, are they taking the sugar out?
We have brought up some excellent questions.
That, is it?
What?
These are really good questions, but I love it.
We need a dietitian on again.
Right.
And we need all
but
these questions.
These are really good questions that, yeah.
Well, on those capsules, they should probably
we need someone to go back and look at them and write notes.
Right. Well, on the capsules, don't they have to have a nutrition label on a capsule as well?
Yeah, they do, but it doesn't necessarily talk about absorption. Is it being absorbed?
Oh.
And that's why I say I keep seeing this Nature Balance and everybody talking about how it's just this super fantastic thing, gives you energy beyond belief. And Kathy Gifford's doing all this. She's skydiving, doing all this stuff. But if you look it up, you have to take 4 pills of each of them a day, and it's expensive when you think. And why can't I just have my blueberries and wash them and put them in my little thing, and I separate it for like a handful, and why can't I just have my blueberries? That's right.
Well, you can, and that's what I do. I mean, I'm not a supplements kind of person. I think that's pharmacy getting rich. I think if you can afford to go get some fresh blueberries, I think fresh is always best. I mean, it's the way nature intended.
Mm-hmm.
Otherwise they would have grown blueberry powder on a bush, but that isn't how it worked. It was a blueberry.
I saw a thing on YouTube the other day about green beans, and the guy was a nutritionist. He said, why are you? He said, if you want to buy the fresh green beans, go for it. But he said Same thing that doctor, he said, take the green beans out of the can, put it in your little strainer, run the water over it for 5 minutes, and you have the same thing.
Well, see, I disagree there. Of course, I'm not a doctor, but I've done a lot of research. I think frozen, because they fresh freeze vegetables, but canned things are processed and they are so cooked down. And the more you cook a vegetable, the more you're draining out the nutrients. It's going in the water. The nutrients are going in the water. So I think if you can't get fresh, frozen is the way to go. I don't eat, the only thing I will eat are canned tomatoes if I'm making chili or something in the winter, but I don't eat any canned products.
Well, yeah, because you were talking about earlier, salt being a preservative. You will not find canned products that aren't loaded with salt.
Right. I mean, even black beans are, and I'll use black beans, but I just rinse the heck out of them because they have to be cooked down anyway. Really, you're eating black beans for the fiber, I think, more than anything.
I don't eat black beans.
Oh, well, you should, Douglas. Oh, and you know what? You'll be a happy camper because you'll just poo good. I mean, beans are good for you and they're a good sense of protein.
Well, it's like asparagus. My neighbor cooked asparagus, and I'm 62. I've never had asparagus my whole life. It wasn't one of the things. And it was like, damn, I went back for third helping of asparagus because it's
There you go.
this crap is really good.
Asparagus is a powerhouse, and you know this is the time when it's fresh. It's like a tulip. It's like a tulip or something. It comes out of the ground every spring. So this is when it's fresh, and this is when it's cheapest.
Squash.
And you can eat it raw. You can actually dump it into salads and stuff.
I eat it raw. I've been putting it in my my little box, Kim. The asparagus.
That's awesome. And you know what I do is if I steam it, so I keep a bucket in my fridge. So when I actually steam vegetables, I like especially asparagus and artichokes, and add all kinds of flavoring into the broth when I'm steaming it. I take that broth and I put it in the fridge, and within the week I use it as my.
You use it as what?
Because that's where, so that I don't waste all the nutrients. I use it as my base for a soup because I can't have packaged broth in, except for the natural broth that's in the freezer, the bone broth from the freezer. Because preservatives now, since the COVID shot, I can't have them. So I have to think of other ways. And someone told me to use the broth from my vegetables that I cook during the week. And then on Sunday, I can put together a soup in my Instapot. Just take some, extra vegetables, some potatoes, some chicken from the freezer, and throw it into the vegetable broth that was left over.
Right.
Artichokes and asparagus. And that's where all the nutrients are.
Right. Yeah, that's why I don't really care for canned goods. That and the sodium.
Well, I've never had it, and I went over to Jerry's and they had it, and it was like, all right, and he just begged, come on, Doug, you tried all this other stuff we got you to eat, now try it. And I went back for 3 helpings because it was like, damn, this stuff's kind of good.
Douglas, when I started with this new diet and everything, well, it's not a new diet, but when I changed my lifestyle, I would just go and walk around the produce department and I found all kinds of things and I would try them all. Like jicama. Have you ever had jicama?
Never heard of it.
Most people haven't. And I mean, up here in little Xenia, Ohio, there's jicama in the produce section. I never noticed it before because it's not pretty. It's brown. It looks like a bulb, like a tulip bulb, except for it's bigger. And it really doesn't have a lot of taste, but it's good for you. And if whatever you put on it, like you could put garlic powder on it, you could put, anything that you put on it. And it has the texture of like an apple or a water chestnut. It's just white and a little juicy. But there are so many good things in the produce department that we just walk by.
I would have never tried kiwis till this year, and now I love kiwis now, and I'll cut them up and put them with my strawberries And another one I'm doing a lot now. I didn't think celery. I'm just eating celery cold now, and I
I
put
don't
it
like
with.
celery because of the strings. I only use it for soup. No
Oh,
matter how
you know
much
what
I
we do
string it.
is I shave them. I shave the celery. I shave the back of the celery with a mind
Well,
peeler.
I do too, but it just seems like, I don't know. It's a
But
texture
yeah,
thing.
so I bought those little Dollar General store bucket things that have the lid, and I put all of it in one little thing for a snack bucket now, so that I don't eat the junk. And it's got carrots. I love carrots. I've always loved
You know what
carrots.
else is good? Do you eat radish?
Never. I don't think I've really tried it.
Take a radish and just slice it up. And sometimes they're peppery. They're not always peppery. It's weird. I don't know if they're different varieties or you just get one that I don't know is more peppery, but usually they're not, and they're good. They're just crunchy. I think a lot of things that my habits, I like to do this. It doesn't matter if it's a potato chip or a carrot. I just like doing that. And so if you train yourself to do that with healthy things, you can do it a lot.
I wonder if that's why I like blue. I never had blueberries. It just wasn't one of the things I grew up. We grew up like my mama and papa did. Mom made chicken fried chicken, chicken fried steak. I mean, it was. I don't know what kind of diet it was, but it was the normal middle of the road fried food or baked chicken or chicken and dumplings type. But until I tried I would have never tried blueberries until Kim convinced me to try it. And now it's like I drove to my brother's last time and stopped and put them in the truck and I snacked them on the way, just cold.
Well, did you see the picture? I don't know if I posted it. I sent it to Kim. I take my empty blueberry container, which I have right here. I'm going to show you. It's empty right now because I'm getting ready to fill it up. But I take this with me. I put it in my car, but I fill it up. I fill it up with whatever's in my fridge. I need to cut today. I cut once a week, so I'll cut up carrots, radish. I'll cut up. Well, I already have. Do you like red pepper? You like red peppers, don't you?
Okay, yeah.
Well, I'll tell you what. I was never a red pepper fan, but now I love them. You know, once you start taking things out of your diet, I take cauliflower. Anyway, I just fill this container up, and after my workout at the gym, I just again, I like doing that, and I just have a ton of them. I eat the whole thing.
And that's why, like I said, last night I couldn't sleep, so I got up, and it was like I wanted to munch on something, and I went out the refrigerator and got those blueberries and just sat down right there on the steps and had a whole handful of blueberries.
Looky here, Douglas. Oh, I got more. I need to cook them today.
That's got to be better than the potato chips or the ding dongs or cupcakes or that I used to eat.
Of course it is.
They're not.
I'll tell you something else that's really good. Have you ever seen these in the grocery store? These are really good. Sugar snap peas. These are excellent. These are excellent. Let me show you what it looks like. They're excellent for snacking. Hang on a minute. I'm getting all my stuff out.
Blueberries are cheap. I got a big thing of them too, but
what are they?
Blueberries, but I think I paid about $8 for the thing of them, and it's 1 pound, 2 ounces. So
yeah.
Well, you have a big one.
Yeah, they're expensive right now, but they're actually, if you have our simple booklet, Douglas, you should maybe remind me next week and I can cut it out for everybody. But there is no, it's not in there. Actually, I need to put it in there. That's what I was going to do. Blueberries are clinically proven to actually somehow impact the quality of the blood. And it's actually, they're able to see the difference it makes somehow literally within an hour of people eating blueberries.
Wow.
And there are clinical studies on it. You can Google it. And
On blueberries?
on blueberries, they're actually, look up, just Google clinical study on health of blueberries for blood, or clinical studies on blood
here's
with
something
blueberry.
else.
In a quarter mile, turn left.
You know,
Huh.
they say, I don't know who they are, but eat what's in season. And it's so true. Like I got raspberries last week and they were awful. They were mushy because it's not raspberry season. I think blueberries are a little easier. They're more expensive though. But if you get blueberries in what, June or July? Is that what it is? I forget now. But they're in season.
Jerry was telling me that, Marcia, that they love raspberries, but he said we only buy them a certain time of year.
Right, because they're not in season now, and they probably are being shipped from some hothouse in Mexico. You know, they're not quality, and they're expensive.
Kim McNicholas, I found a thing on blueberries on the web, and it says, I can't pronounce the word, but anyway, while all berries contain anthocyanins, blueberries have one of the highest level. The research showed that these anthocyanins improve the function of endothelial cells in the body. But this is what got me. It said these cells line the inner surface of blood vessels and help with blood flow and blood pressure regulation. So I'm going to start eating more of them every day.
And they all berries are. I'm getting my berries out too.
Yeah.
Yeah, I guess I'm gonna order me some more blueberries.
Yeah.
Strawberries are really good for you as well.
I love strawberries.
I do too. And they're in season. They're more spring.
I love strawberries. Got to find a hard whipped cream to do the strawberries with, though.
What?
Got to find a healthy whipped cream to do with the whipped strawberries.
You know what I do, Douglas, and I love it. I do it with what's this stuff called? It's like a whipped cream, but I don't use much, and I don't eat much sugar. So, like, you're allowed a little bit, but I'll put it like a tablespoon of that. I'll show you my bowl. Make some. I usually eat one of these an evening. I don't know if you can see the size.
I can see it, yeah.
But I eat one of these. I fill it up with strawberries, raspberries, whatever fruit I have, and blueberries. I put like one little thing of Cool Whip in it. And then I put some cottage cheese and I put artificial sugar, which probably isn't that good. And I'll put orange zest. I don't know if you like oranges, but the flavor is out of this world. I feel like I'm eating ice cream. And it's so good for me.
That it's along those same lines. What Marcia is saying is I get the unsweetened vanilla cashew milk or almond milk yogurt, and I add some walnuts, and I add a little touch of raw natural honey to it. And oh my goodness, I'm addicted to that. I will go back for even another bowl with it because there's so many textures, and sweet and savory and tart, and I mean everything just, oh, I love it.
But I've been told honey's not good for you because of the sugar.
Right, but if it's better than the other sugar, and it can have some value. There is some value to honey, but don't cook it. Number one, don't eat anything that has it cooked in it. And number two, don't use a lot of it. Just like anything. Like Marcia says, you know what? I'm going to have a little bit of Cool Whip. That's my indulgence. And a little tablespoon is not going to hurt her when the rest of it is all really good things. And it's just a touch.
And I'm using cottage cheese. I mean, which is dairy, but you know, you do need a little bit of, I think, dairy, just not full fat.
Yeah, well, it's just some
know.
people are like
In a
me and
quarter mile,
others.
turn right onto Deer Park
It
Road.
can cause inflammation in the body, like my dad and me, and so you don't know sometimes if it causes inflammation for you. But if you're doing great,
Right.
But you're right. People do need some good healthy fats in their diet, and if that's the only way
Turn
they
right
can
onto
get
Deer
it,
Park Road.
and it doesn't cause inflammation in the body, then that's fine. And you'll know it with when you get your CRP or your inflammation test, it'll show up for the most part, I would imagine.
What is Nancy showing?
And that.
What is that, Nancy?
They mentioned cottage cheese, and that's what
Can't see it because you're blurred. Can you put it in front of you?
I'm trying. I just get it and then it fades. Anyway, it's Shamrock Farm
Low fat.
Cottage cheese, and I eat it every day for lunch.
There you go.
Yeah.
And it's low fat. Yeah, low fat.
Yes.
Excellent.
But
Here's my orange.
I
Never.
put strawberry jam in it.
Oh, well, strawberry jam though, you're talking extra sugar. Well, of course, I'm eating sugar too.
Yeah.
I bet that's good. How much strawberry jam do you use? Just a little bit?
What in here? And I just put a little bit. Yeah, just to flavor it.
That's
just like eating wet dried milk.
Right. Kim, you were talking about the honey. You know, if you do use honey, that you should always use local, because like if you get a cold or something, local honey, the bees are from you locally, and it helps you fight things off.
Yeah, I agree.
Well, see, I don't buy honey from HEB or that. My primary doctor has, at the end of his counter where you pay your copay in that, he has a gentleman who's a patient of his that has his own beehive farm here in Southeast Texas, and he does his own honey here. And I always buy it when I'm there, and it's enough because I don't use it a lot, but I still like it. So I always buy some when I'm there.
I never really liked honey very much. I don't know why. It was never my thing.
I've always honey and biscuits. We grew up making honey and biscuits. So yeah, honey was. And pure cane syrup. But I don't have.
What, Douglas?
It's like pure cane syrup. 100% sure. It's nothing.
Right. Yeah, you don't want that.
No. Well, I got to take Stella. She's looking at me.
Yep, and I just arrived at the hospital. I'm going to visit one of our new patients that I took her to the doctor's appointment yesterday, and she was admitted. She called our Leg Saver hotline, and she was in big trouble. And so she wasn't going to go to the doctor, and I picked her up. I drove half hour to go get her, and then an hour to take her to this new doctor. And so they didn't let her go once I got her in there. They admitted her with nothing. So I just went shopping, got her some good items, some reading materials, Vaseline, cream, all of the above. And
how long do you think you'll be there, Kim?
I'm not going to stay very long because I got 2 dogs, and I'm hoping they showered her.
Yeah. I wanted to talk to you if you get a chance, maybe on your way back, if it's not late.
Oh yeah, I have an hour and a half drive on the way home. So this isn't close to me.
You need to call the nutritionist so we can have another show, because we talked about a lot of things this afternoon that we need we had a lot of questions that maybe the nutritionist could answer for us
Yeah.
about.
I think you
I
should.
think that'll be great.
I think we should try and get somebody fairly regularly on nutrition because nutrition is so, and I constantly come up and I study it fairly in depth, and I have questions all the time, let alone somebody who just wants some quick hacks.
And that's a good thing that we need, because it's constantly changing, isn't it?
Well, some of the basics don't, but yeah, some of the
I was
products
constantly changing about what I eat, like asparagus and like blueberries, and do I need, is Wright's liquid smoke really that bad, or is it just one of those things, and
Douglas, remember when you go to the grocery store, this is what I have learned, is to stay on the outer edge of the grocery store. Because most of the boxes and the canned goods are on the inside.
Yeah, but the macaroni and cheese is on aisle 6.
Exactly. Unless it's Easter, then you can eat what you want. No.
Well, apparently you did, didn't you?
I did. I sent a picture of my plate to Kim. I don't know if you saw it yet, Kim. Is she still there? And I said, see, I don't always eat good.
Her stuff is really not that bad. I looked at the plate and I was like, if that's how you splurge, seriously, you need to get out more.
There were rolls. There was, I don't know. There was all kinds of bad stuff on that plate, but there was good stuff too.
Yeah, I thought you did really good. I saw berries, like I think I saw kiwi and some berries and eggs.
You did. You did.
Well, then I don't need to send you a picture of what my plate looks like sometimes when I go out and eat.
Well, this was all home cooked. It was my girlfriend's house. We did Easter yesterday.
I'm going into the hospital, guys. I love you all, and again, thank you for the discussion, and thank you to Josh for helping us out. And he's just playing such an integral role in helping us so much. And he is, going to help us put the show and get some of these clips up that'll help so many other people with so much great information. And Douglas, thank you. You did a great job getting things going. Once you, sorry to distract you from the NASCAR race. I was like, Douglas.
I was looking out to my neighbors. I'm now in the middle of the Hatfield and McCoys.
Oh God!
Yeah, Billy's brother died across the street. His brother died 2 weeks ago, and now Billy owns half the land down here. Some of the land he shared with his brother, he never put in his name. So now the family's fighting over land and houses. So I'm stuck with my 5 acres in between the Hatfield and McCoys. And they were out there at the beginning of the show, and their hands were all over it was like I was waiting for the first gunshot.
Oh God. That's what you were distracted, worried about you. You were looking like
I was waiting for the first gunshot because I pulled out my 9mm just in case I needed my protection.
I'm gonna jump off, guys.
All right. Bye, everybody. I'm gonna hop off too.
All
Bye,
right,
everybody. Thank you. It was awesome.
So Nancy, one night this week we're gonna do it, okay?
Yeah, I was gonna say we've been on this particular show for 4 hours, and you were worried about whether or not we'd have enough to talk about in 1 hour once a week.
Yeah,
That's true. I almost wonder if 1 hour isn't long enough.
well, we say it's going to be an hour, but it always goes over. It always because I'm retired, and I can sit here and do the Zoom, but I'm not going to cut it off at an hour if it's that kind of conversation we need to have.
Right.
I'm not going to cut anybody off. I'll sit here for 4 hours on a Wednesday night till I'm blue in the face if I have to let people share. I'm not going to cut it. Well, your hour's up. Sorry.
Yeah,
Checks
that's
in the
awesome.
mail. No.
That's awesome.
So that's what we're going to do. Okay.
Sounds
fantastic.
Go Beans. Y'all have a good one then.
Thank you. You too, Douglas.
All right.
Bye.
Bye, Josh.
Bye, Douglas.
All right, buddy.
Bye, buddy. Thank you, Joshua, for hosting.
Oh, my pleasure, Nancy.
Yeah. All right, I'm leaving.
Have a happy Easter.
Bye, you too.